Good morning and welcome to day 2 of the 13th National Conference on Health Disparities and the 2020 National Environmental Justice Conference and Training Program. I'm Carolyn Sawyer, and it's an honor to be with you all for this second day of this very important conference. This is the conference where we're addressing health disparities, environmental justice, and we're looking at the future of health care. And we're so excited to have you be a part of this discussion and to have the panelists that we have with us today to also engage in this discussion. Today we'll have panel 3, 4, and 5, and I'll be back again on tomorrow for our 2 remaining panels. Today we'll look at everything from mental health to climate control, broad range of topics, but all very important topics. And so again, we welcome you. We appreciate you being a part of this discussion. As we said on yesterday, this conference addresses really 3 overriding themes. That's the role played by the social determinants of health, including poverty, race, environmental quality, housing, education, attainment, and public safety. The second is personal responsibility. And the third is prevention. Wonderful discussions on yesterday by our panelists on yesterday. If you'd like to take a look at that material, it has been made available. Emails were sent out this morning to allow you to review yesterday's session if you missed a portion of that. But without any further ado, I'd like to get us started on our panel 3 this morning. This is the panel that is talking about the evolving crisis of disparities in the recognition of and access to treatment of mental health and substance use disorders. Leading this discussion today, we have a wonderful moderator. I'd like for you to welcome Ms. Audrey Wetzel. She is the CEO of Resource Partners, LLC, and MHDG Management Services, located in Charleston, South Carolina, with offices in Washington, D.C. So without any further ado, I'll turn it over to Audrey. Good morning, Audrey.
Good morning, Carolyn, and thank you for that introduction. Good morning to everyone. I also serve as a board member of the National Conference on Health Disparities and welcoming the panelists that you have before you today. First, I'll introduce the following panelists who will be presenting in the order for which I introduced them. If you have any questions, please feel free to place those in the chat and we will address those at the very end. Each panelist will have 15 minutes to present. And we will have a Q&A session at the very end, which will take about 15 minutes. But I will first start out with one of our panelists during this session, and that's Dr. Elvin Price. Dr. Price is a Victor A. Yanchik Associate Professor and Director of Geriatric Pharmacotherapy at the Virginia Commonwealth University School of Pharmacy. He's co-director of the Institute for Inclusion, Inquiry, and Innovation, I-Cubed, as it's called, Health and Wellness, Aging in Richmond, Virginia. Welcome, Dr. Price. Once Dr. Price completes his session, we will hear from Dr. Miriam E. Delphin-Rittman. She's the Assistant Secretary for Mental Health and Substance Use for the U.S. Department of Health and Human Services, Administrator for the Substance Abuse and Mental Health Services Administration, known as SAMHSA, in Rockville, Maryland. Then we'll hear from Mrs. Toni Smallwood. She's president of the National Association of Mental Illness, known as NAMI. She resides here in Charleston, South Carolina. She's also an advocate for a family member who suffers with mental health disorder, and we welcome her today as well. So we're without any further challenges to this event today. We are live here for this event, so we're looking forward to a healthy discussion at the very end. So Dr. Price, we're going to get started with your slides.
Thank you. First, I would like to thank the organizers for the invitation to participate in this panel today. And I'm excited to be here with you all. Thank you all for being here. My topic, I'm starting the panel with the evolving crisis. So I would like to first sort of paint the picture of health disparities in general and some of the contributing factors to those health disparities. And then we'll approach our topic of mental health and substance use disorders. So many of you are familiar with the county health rankings model that really helped to illustrate for a large portion of society that 80% of what happens to us in regarding health-related outcomes is actually connected to environmental factors and health behaviors and what we refer to, or what has been mentioned so far in the conference, the social determinants of health. So if those 80% contributors outweigh what actually happens in clinical care, then this means to improve outcomes of health for any disease state, we have to consider the entire spectrum of an individual's life, those social determinants of health, those health behaviors, and then the clinical care that they receive. Now, that clinical care is impacted by access issues and is also impacted by the quality of the care that an individual is going to receive. Now, issues arise when access is limited and also when the quality of care that an individual receives is also not optimal. And we'll examine factors that influence this entire spectrum. And so to do so, translational approaches are required. This means that we have to be able to understand what basic evidence tells us, and we have to be able to understand what the clinical evidence is telling us and how patients are feeling and what the outcomes are telling us in terms of the particular disease states that we're interested in. So in our case, mental health and substance use disparities, we need multi-faceted approaches. So this was recently, as one of the panelists mentioned yesterday, a floodlight was directed towards health disparities when we started to examine the data around the COVID-19 pandemic. And so the social determinants of health, as illustrated in this editorial that was published in the New England Journal of Medicine, these social determinants of health were down here at the foundation of the disparities that we were witnessing. And then those were also contribute to the chronic diseases that we've been hearing about as predisposing conditions. And so these things working in parallel cause a major issue of disparities. The Association of Black Cardiologists wrote a brilliant paper in Circulation that said that we need to first recognize these social determinants of health and also not ignore biology, and then propose solutions that first start with addressing the social determinants of health if we're going to do something about, in particular, the COVID-19 health disparities that we were witnessing. The same is true for mental health disparities. So what are some of the issues that people have? We need access to housing, better food, better access, insurance, education, health literacy improvements, technology improvements, protection for work. All of these things were brought out by the Association of Black Cardiologists. Now, why is this so important? Well, this approach is usually not considered when we are taking care of people in communities. I'll give you an example of some of the work that we're doing here in Richmond. The Virginia Commonwealth University supports a program that we call the Richmond Health and Wellness Program. And basically, we take our services and our people into communities, and we provide services to people in what we provide services in clinics that we establish in their communities. So if it's in our congregate housing buildings, we have these services that address the social determinants of health and help to coordinate clinical care and in the places where individuals live. So as an illustration here, we're in year 9 with this program. We have clinics in these different buildings that are subsidized low-income housing for older adults and a freestanding clinic. We work with community providers and other community partners, and we take all of our faculty and students into these programs to help individuals have better qualities of life in the place where they live. You don't have to leave to catch the bus somewhere or walk. We're there in designated space in the buildings, in the communities where individuals live. And so there's publications that if you're interested in reading about some of our outcomes that you can see here. So we've addressed housing. So the Association of Black Cardiologists said we need to address housing. We need to address food and meals. So we have these programs there, and you can see we publish about these initiatives. COVID-19 revealed these disparities in access to telehealth and telewellness. So we created telewellness services for individuals that needed assistance and help when they were isolated. We also are doing work on the biology, and this is really my work that I lead around personalized medicine and genetics. So how can we have better outcomes for all of the drugs that we're treating people with all of these chronic conditions? Well, there's a lot of information about personalized medicine that we are implementing in our low-income senior housing communities. We also created vaccination clinics. So all of the needs of people, we were trying to meet those. Most importantly, as it relates to mental health and substance use disparities, we asked individuals, where would you like to receive your services? And so we surveyed nearly 400 of our participants around their interest in receiving mental health services and support for substance use disorders. And to our surprise, the individuals with the greatest need actually were interested in receiving their services from community-based organizations and not the traditional physician's office-based approach. So we were learning from our participants. So now we address the disparities. How could we have them, and what are some of the issues that contribute to these disparities? Well, we know that mental health disorders are among the leading causes of chronic disability globally. And so this data is a few years old, but it helps to illustrate the overall burden of depression, alcohol use disorders, anxiety, migraines. So as we look across the chronic burden of disease, mental health disorders are there. And so now we have to consider, why do we have poorer outcomes for certain groups of people? Well, if we think about substance use disorders, we've seen shifts in the patterns of what are the risk factors and what contributes to going down a path of substance use disorders. And over the last 10 years or so, we've seen a shift from what was generally considered these traditional gateway drugs to now opioid pain relievers being the major contributors to new heroin addiction. And more recently, we've seen now this rise in synthetic opioids being the cause of spikes in opioid-associated deaths. So for many of us, I'm born in '79, and so for many of us, our age, we saw one of the musical icons from our childhood, Prince, die from a counterfeit pain reliever that was spiked with fentanyl. So as we examine these, how do we see these adverse events happening more in certain groups of people in response to being exposed to substances of abuse? To answer that question, we have to first think about how the drugs work. And so we know that there's variability based on genetics in the production of the targets of drugs, the elimination pathways of drugs, and the pathways that influence how you uptake drugs after you've taken them. So how do you absorb them? So how do you absorb them, eliminate them? There's variability there influenced by genetics, and that variability is different across ancestry. Okay, so here as an example to illustrate, one of those drugs that is one of the leading causes of death in response to opioids is tramadol. So how do we see this variability and risk of death? Well, tramadol is converted after you take it by one of our major liver enzymes that we're familiar with, people have studied for 50, 60 years. Once it's converted by 2D6, it is converted to an active form that's 200 times more potent for its effects than the parent drug. Some people have more activity for this enzyme than others. This we know based on genetics. Now, access to implementation is limited in certain groups. However, what we're seeing is experimentation or taking opioids in the streets is like flipping a coin. You may find out that you are one of these people in one of these groups that is more sensitive, that may die suddenly in response to taking certain drugs. We know, and so this is, I'm showing you an almost 20-year-old slide on purpose here. We know that in different groups based on ancestry, the likelihood of having classic function of one of these enzymes versus non-functional or reduced function differs based on ancestry. So based on ancestry, you may be more primed to take a substance and pass away. Now, why is this important? Well, we have clinical guidelines now for the therapies, for the opioids, clinical guidelines that help us to make decisions based on how well you may respond to certain drugs. This is important because these same enzymes also are responsible for how we respond to certain drugs that are used for many of our mental health conditions. So I'm showing you the guideline for selective serotonin reuptake inhibitors, or SSRIs, our most prescribed antidepressants. We think about Zoloft, we think about Prozac, those, or Celexa, or Lexapro. Those drugs have variability in response that's influenced by genetics. And we have a guideline for that. I'm just showing you the snapshot. I don't have time to go into the guideline. In our second most commonly used class of antidepressants, the tricyclic antidepressants, things like Elavil and Pamelor, we also have a guideline. And these are the same genetic variants or the same enzymes that also influence our responsiveness to opioids. So opioids, depressions, anti-anxiety drugs, we have guidelines that can help us to tailor the therapy and make our outcomes more effective. However, there is a lag in implementation. Even after having access to just get some assistance or to get some treatment with mental health, there's a lag in application of these type guidelines that help us to make these decisions on matching the right drugs to the right people to get optimal outcomes. So I hope that in this short period of time that I illustrated that we have issues with access. We also have issues with optimizing therapy for certain groups of people that we're treating for mental health disorders or those that have substance abuse related disorders that help. We have these disparities that are not being optimally treated. And in some cases, we have tools that could be used, but this requires a more purposeful approach to optimize the outcomes for the individuals in both categories. This also involves meeting people where they would like to receive the treatment, where they're most comfortable with receiving treatment. And with that, I hope that I save some time for discussion.
All right. Thank you, Dr. Price, for that great information. And we're certainly going to entertain questions at the end of the panelists' presentations this morning. So we're now going to hear from Dr. Miriam E. Delphin-Rittman. Dr. Delphin-Rittman, good morning again.
Good morning. Good morning. So, I so appreciate the invitation to be here and to present at the conference. I do have slides, so I know they're probably, not sure if they're projected. Yep, there they go. Okay. Yeah, so it's just a pleasure to be here this morning and to meet with everyone. So looking forward to the discussion and such an honor to be on this panel with my fellow panelists. I'm going to quickly go through my slides again so that we have time for discussion. But essentially, next slide, please. I'm going to present an overview of SAMHSA, and then I'll talk briefly about the Office of Behavioral Health Equity. We'll talk a little bit about the class standards, the social determinants of health, and then some of the specific SAMHSA programs that get at some of the social determinants that I'll be talking about. Next slide, please. So SAMHSA, in terms of our mission, our mission, which was established in 1992, has not changed. It's to reduce the impact of substance use and mental illness on Americans' communities. So that has remained the same. Recently, I've identified 5 priorities and 4 cross-cutting areas. I'll talk about those areas, and then you'll see how that drives some of our work. Essentially, our key priority areas are preventing overdose, enhancing access to suicide prevention and crisis care, promoting children and youth behavioral health, integrating primary care and behavioral health care, and using performance measures, data, and evaluation. In terms of cross-cutting areas, we have equity, workforce, recovery, and financing. So let me see. I'm going to try to pin this slide here so I can see the slides that are being, okay, so I can go from my slides. Okay, next slide, please. So now I want to provide a brief snapshot of behavioral health disparities landscape and what some of the data is currently suggesting or showing as it relates to disparities across different racial and ethnic groups. I'll start with some of our NEJC data. So that's data from our National Survey on Drug Use and Health, and then talk about other data that we have as well. Some of our NEJC data, and again, the NEJC is recently came out. We released it this past week, in fact. This is a national survey across the country of individuals who live in households. What the NEJC showed is about 1 in 5 adults with no mental illness within the past year perceived that the pandemic negatively impacted their mental health, quite a bit or a lot. We also saw that about 1 in 5 adolescents perceived that the COVID-19 pandemic negatively impacted their mental health. Same thing, quite a bit or a lot. I'm going to talk now about some of the specific data within the NEJC, disaggregated by race and ethnicity, looking at suicidality. The NEJC, essentially, we release an overarching report, and now we're going to release a series of race ethnicity reports. But I'll share some of the race ethnicity data as it relates to suicidality. This is an area that we are particularly interested in SAMHSA. We know over the past year, young people have struggled. The whole country has struggled, really. And so really wanted to get a better sense of what some of the suicide-related data said, disaggregated by race and ethnicity. And so I'll show you some of that. Next slide, please. So essentially in 2020, about 4.9% of adults over the age of 18 had serious thoughts of suicide or made a plan or made attempts. I'll now disaggregate it and talk a little bit about some of the trends, across different groups. This slide is busy, but I just wanted to be able to show the comparison across. So for example, white Americans age 18 or older, about 5.3% had serious thoughts of suicide, made a plan, and about 0.5% attempted suicide within the past year. So you can see the trends in terms of the groups that have had the highest. For example, individuals with 2 or more races had the highest rates of either serious thoughts of suicide, having a specific plan, or attempting suicide within the past year. And then you'll see different racial and ethnic groups. So 2 or more races had the highest rates there, followed by Alaska Native American Indian individuals had high rates as well. And so you'll see the trends there disaggregated by race and ethnicity. Okay, next slide, please. So I now want to talk a little bit about also overdose deaths over the past year. So this is CDC data. And we know, across the board, when we look at overdose data for 2020, we've seen increases, really increases for all groups. The groups where we've seen the most significant increases are Latino Americans and African Americans. And you'll see the bottom part of the slide there shows that trend in terms of the greatest increases in overdose over the past year. So this data is concerning. It lets us know that in addition to addressing overdose overall across the board, across the country, that we also need to think creatively and innovatively around how do we connect with and help to outreach individuals who may not be connecting with services or who may be disproportionately impacted by some of the overdose trends that we're seeing. And so some of our work at SAMHSA is addressing that. Okay. Next slide, please. So I just focus on those 2 data points. I want to talk a little bit now about our Office of Behavioral Health Equity and some of the work within SAMHSA to address some of the disparities that we're seeing. So the Office of Behavioral Health Equity is an office within my office, the Office of the Assistant Secretary. It's essentially focused on working to reduce disparities in behavioral health, working to increase access to services and supports for individuals that are marginalized, are under-resourced, and may not be connecting with services and supports. The goal is to help communities thrive, and to help to promote healthy community health, or health from a community perspective. Next slide, please. OBE has 5 domains of work that sort of drives the work within the office. It's looking at policy. So we know it's so critical to think about, what policies can we put in place to meaningfully impact disparities and the patterns and trends that we see. Data, and you saw that data was one of our key priority areas within SAMHSA. It's also one of the key priority areas within OBE. A key thing for us is, and a question that we're exploring now is, what is the impact of our various funding initiatives, whether it be the SOAR grant, the State Opioid Response Grant, or any one of our grants? When we look at the data we have associated with those grants, how does it break down by race and ethnicity? What does equity look like in terms of individuals that are accessing the services and supports that are funded across the country by our various grantees? So we're excited about that work. We also collect performance data, national outcome measures, quite a bit of data from our grantees. And some of the goal of the office is to really look at that data to be able to identify patterns and trends and the ways in which the services may be promoting equity, or in some instances, are there disparities trends that we need to get at? Workforce development is another area of focus of the office, communication, customer service. We do quite a bit of presenting across the country in terms of some of the programs and initiatives and work of the office. So From that perspective, we really see ourselves also as serving, serving as it relates to promoting equity. Next slide, please. I want to talk now a little bit about the behavioral health guide to the class standards. So we know the class standards put out by the Office of Minority Health. It was put out probably about 2013 or so. And so they are 14 standards that, some of the conceptualization is if they're implemented either at an organizational level or even at a system level, it can help to reduce disparities. They're broken into 4 or 3 overarching groups. So governance, leadership, and workforce, communication and language assistance. We know that language is critical. Also engagement and continuous quality improvement and accountability is a third area. What the behavioral health guide is, it's essentially a guide for behavioral health providers around implementing the class standards. So we're real excited about this and are currently in the process of disseminating it and helping to share information about this resource in partnership with the Office of Minority Health. Next slide, please. So I'm going to shift now a little bit and talk about a little bit about social determinants of health and then some of the SAMHSA programs that get at different aspects of the social determinants. As you know, HHS defines social determinants, and I'm sure you've been talking about this probably over the last couple of days, but the conditions in the environment where people are born, where they live, work, play, worship, and age, ultimately that affects a wide range of health and health outcomes and quality of life outcomes. So things like education, healthcare, neighborhood, environment, social and community context, economic stability. All these areas make up different social determinants of health. Next slide, please. So this slide depicts the social determinants as well, along with some of the areas that are connected with or outgrowths of various social determinants. So of course, we know, economic stability will impact things like housing and employment. Education will impact things like our early education or even graduation rates. Health and healthcare, access to things like services in general, even telehealth services. So we know social determinants have a direct relationship to various specific outcomes that ultimately profoundly impact health and wellness from a community and individual perspective. Next slide, please. Okay, so I'll talk about, again, a few specific programs that get at social determinants within some of the programming at SAMHSA. Next slide. So one program is we call it our RECAST program. It stands for Resiliency in Communities After Stress and Trauma. And essentially, this is an initiative that is geared towards local communities that have experienced civil or social unrest, or where there's struggles at the community level, either in terms of connection, youth resilience, violence. And so essentially what this initiative does is it funds communities to develop sort of innovations. And we truly believe that, communities know what's going to work for them. So that it's pretty wide open what can be proposed here. And I can say in my role, it's just been wonderful to see what has been proposed and the innovations that communities have put in place to help promote healing and resilience at a community level and real creative, innovative partnerships. It essentially is a program that helps to assist high-risk youth and families to promote resilience and equity in communities. It provides evidence-based training and education, violence prevention programs, community youth engagement programs, links to trauma-informed behavioral health services and supports. And so a range of services and supports that are community-defined, and that really is the key, that are community-defined. That will make a difference. We often talk about evidence and, a lot of the work I would say within this sphere of our work, it really honors the fact that evidence exists on a spectrum. There is community-defined evidence. There may be evidence-based practice that is a sort of randomized clinical trial. But we really believe that community-defined evidence as well as practice-based evidence are equally important. And some of our work now that we're working on through the Office of Behavioral Health Equity is working with community members to be able to apply for grants, evaluate those grants, keep the grants, really just become ongoing grantees. And some of my thinking is that really can help to expand and move different programs and innovations at the community level, move them along the evidence spectrum. So we're real excited about that initiative. We call that Elevating CBOs, so our Elevating Community-Based Organization Initiative. Next slide, please. Another initiative is the Food and Mood Project. And so this is an initiative that is a collaboration in our Region 7 with USDA in the Mountain Plains region. And we know there's such a connection between sort of food and wellness and community health. To the extent that communities have access to healthy food or vegetables or fruits or all of that can help to promote health and wellness. And so this initiative it's a K through 12 initiative. It's about creative collaboration and partnership at the community level to help communities have greater access to food in terms of either healthy food or culturally congruent food, school gardens, really to ultimately be able to create community and to further promote health and wellness. Next slide, please. And these are just a few other examples, programs that get at different social determinants of health. So for example, we have our substance use and HIV navigator program for diverse groups. And the goal here is really forming peer relationships and partnerships to help people navigate services and supports. So individuals who are in recovery, partnering with other individuals who are looking to sort of continue on in their recovery journey, and helping them to navigate services and supports and community resources to be able to continue to evolve their recovery. Another example is our drug treatment courts. Same thing. The idea here is to ultimately connect people to services and supports as opposed to having them connect with the justice system. We know often that people will end up in the justice system when in fact what's needed is treatment. And so this is another area of work that we're excited about. So those are just a few examples. I'm looking forward to our discussion and conversation. Thank you for the invitation to be here, and it's a pleasure. So thank you, everyone.
Thank you, Dr. Delphin Rittman. I'm so glad that you were able to make it to the session this morning. I'm sure the other panelists will have questions for you as well, and I'm looking forward to hearing more about elevating CBOs. I think it's certainly great work, and I always believe that medical communities start at the grassroots level. So Thank you for that presentation. Now we're going to hear from Mrs. Toni Smallwood, President of NAMI.
Thank you. I feel very fortunate to have been invited and included with all of these distinguished panelists. But I will mainly be talking about things from the family side, the caregiver side, and the personal side, and what NAMI offers. And I'm going to pull up the slide now. So I chose this as the title because I think it's very important to meet people where they are, understand, their background, whether it's culture, whether it's ethnicity. It's just very important to take all of that into account. Now, NAMI, people that don't know about NAMI, it is the National Alliance on Mental Illness. It's the nation's largest grassroots mental health organization. I love that that it started as a small group of families gathered around a kitchen table, because a lot of times that's what we still do. We still gather around a kitchen table. Sometimes it's a conference table, but it's families, it's individuals that are trying to find answers and resources to navigate the mental health system. So I gathered up some statistics. Well, I didn't personally gather them up. We have an intern who did that, but statistics, I will definitely go over this, but again, my focus is always from that personal lived side. And so for the statistics, across the nation, the African American population, and this is from the Census Bureau from 2019, it is 13.4%. In South Carolina, it's 27%, and in the Charleston area, it's 26.3%. For Asian American and Pacific Islander, it's 5.9% across the nation. In South Carolina, 1.8%, Charleston, 1.8%. Then for the Hispanic Latinx community, you can see that it's 18.5% nationwide, South Carolina 6%, Charleston 5.3%. For the indigenous communities, it's 1.3%, South Carolina 0.5%, Charleston 0.4%. And then the statistical disparities, a lot of this was from SAMHSA, so thank you for compiling this information. I had never really looked into the disparities, and so I was, in some ways I was shocked, and in other ways I was not, because of talking with people in our community, in our local community, and just hearing from them and hearing about, stigma, about even within their own families, that stigma about talking about mental health, especially it seems for males. It seems like there's still a great disparity where males are expected to just be tougher and just deal with things on their own. So some of the things that that I saw that I wanted to point out was that more likely than Caucasian adults, for the African American communities, they're more likely than Caucasian adults to report persistent symptoms of emotional distress, sadness, and hopelessness, and that African American adults living below the poverty line are twice as likely to report serious psychological distress. In the Asian American and Pacific Islander, I was surprised to see that is the lowest help seeking rate. And I guess I was surprised to see that that's the lowest because it seems smart to try to seek help and get help for any kind of issues that you're facing. But again, it seems like it might be cultural, because it says delayed treatment due to stigma and the lack of culturally competent and holistic mental health care, which definitely worsens their conditions. Then Hispanic Latinx, 34% of Hispanic adults with a mental health condition receive treatment each year, compared to the U.S. average of 45%. However, more than half of Hispanic Latinx young adults may not receive treatment. Then for Indigenous, nearly 1/5, 19% of Indigenous adults experience mental health conditions. And a lot of that is the result of multi-generational trauma, which we can definitely understand. then I want to start talking about some of the things that NAMI is doing. One of the things that, one of the many things that I love about NAMI is that they look at solutions. They look at offering people a guide, like I say, a guide to navigating the mental health system, which can be very daunting, especially for people who have never been exposed to navigating the mental health system and all of the things that that involves, whether it's a child who is under 18 or an adult who's over 18, which can throw in a lot of other things that makes it more difficult to get someone the treatment and the help that they need. So NAMI Sharing Hope is a new program that is, it's 3 videos that is a presentation for African American communities. It's designed to promote mental health awareness. And the 3-part video series also has a facilitation guide. And there's not any formal training on NAMI Sharing Hope or NAMI Compartiendo Esperanza yet. That's something that we're working on, that NAMI's working on. But in the meantime, we are actively seeking volunteers. We, here in the Charleston area, we don't have a lot of people that have been able to volunteer for this. And again, I think it's because of the stigma. But we are hopeful that we will get those, and we have some ideas on aggressively looking for volunteers. And so with the NAMI Sharing Hope, the NAMI Compartiendo Esperanza, these are not interchangeable. These are specific to these cultures. And Compartiendo Esperanza is a bilingual presentation for Latino communities. And it also has 3 videos and a facilitation guide. Now, I had to share the video from NAMI Sharing Hope. It's a trailer because I found it to be so powerful. And so I'm hoping this will play properly.
Tells the night. Question for you. How do you deal with trauma?
So I hope that came through okay, and that everyone could hear that. I just thought that was so powerful, and just had to share that. Some of the programs that NAMI offers, and they're all free programs because we want to make sure that people have access to this information, these resources, no matter what their socioeconomic status is. And the NAMI Family to Family class, that's what brought me originally to NAMI. It is an 8-session class that it teaches family members how to navigate the mental health system, how to advocate for their loved one, all the things that it talks about, the different mental health conditions, the different types of medications. NAMI Basics is based on family to family, and it's for parents and caregivers of children 22 and under, and it covers all of that. Plus, it talks about how to make sure that you're to advocate for your child in the school system, to make sure that they have the best route to success, to be successful in school. Then NAMI in Our Own Voice is a presentation to educate the public about mental health, to let people know that you can have a family, you can have a job, you can be productive, and it shows people how you can manage your mental health, so that you can be productive and reach the goals that you have. NAMI Ending the Silence is where we go into middle schools and high schools, and we talk about recognizing mental health symptoms and what to do next, how to ask for help or ask for help for a friend, and talking about suicide. If someone has a plan, or they seem like they are talking about wanting things to end, and they're giving away their belongings. And so it's just recognizing those things and having those conversations. We have our family support group, which is peer-led. It's by a NAMI trained facilitator who has that lived experience taking care of someone or providing care and support for someone with a mental health condition. We have NAMI Connection Recovery Support, which is for adults with a mental health condition, also peer-led. I compare these to Alcoholics Anonymous because it's all about support, encouragement, and shared experience. Then I love this. This is a part of the NAMI.org website. It's Identity and Cultural Dimensions, because I love to be able to give people resources, like I said, meet people where they are. And I'm going to try to pull this up. I hope you can see it. But it has all these different sections: Asian American and Pacific Islander, Black/African American, Hispanic, Latinx, Indigenous, LGBTQI, and people with disabilities. And when you click on, let's see, we'll go into this one, it provides specific information and resources for, talking about the barriers to mental health care. And I'm a resource person. I love that there's all of these resources specific to those to the different communities, and I have used these. One of the resources I love too is Psychology Today, because you can find a therapist and it shows like a bio of that therapist. So it's I just love being able to offer people something that they can actually use and relate to, and that's it. Let's see. Here we go. Oh. All right. Thank you so much. Thank you for allowing me to be here. And I hope that this information is helpful and encouraging, like it has been for me since we started our journey with our loved one.
Thank you, Tony. Mrs. Smallwood, thanks for that great information. I was so glad to see that you included peers in that presentation. and recognizing the value of using folks with lived experience. Great presentation. Thank you again. We do have a couple of questions, and I know we're coming up on the hour, so I want to make sure that the panelists themselves have an opportunity to ask questions of each other about the content of the presentation. But I'm going to start with Dr. Price. The first question is, do we have mechanisms in place to evaluate how people will process some of these drugs? And does insurance companies actually cover the cost in supporting these efforts as it relates to pharmacotherapy?
Yes, ma'am. Thank you for that question. And the answer to both questions is yes. So there is insurance coverage for the CLIA approved. So the tests that are offered by companies that have had their processing and their tests approved by the FDA. So those insurances do cover some of those tests, so you can get reimbursed for those or just get the coverage. So in our health system and in many health systems, those tests are available through the standard lab processors for many, like Quest Labs and LabCorp, like those types of companies even offer those tests with normal lab processing that happens in health systems. And then you have the there's even direct to consumer tests that have been approved. So someone has the money, they can just buy them for themselves that have been approved. So yes.
Okay, that's great to know. And I guess the follow-up to that question is, how widely is this information presented to the health community? The folks who typically, we know that 80% of those treated with some mental health or substance use disorders treated in primary care. Is there an opportunity for providing that level of education to that community?
To the providers? So that is one of the limiting factors for uptake, or one of the things that has slowed uptake of some of the clinically actionable tests for personalized medicine has been clinician education. And that goes across the board for physicians to pharmacists to nurse practitioners. So just training the workforce. And so there's no special pots of support and money that have been available to help translate the basic findings into clinic. Now there are some initiatives that are underway to try to help understand some of these barriers to clinical implementation for genetic testing. There was a request for applications from the NIH's NHGRI, or the National Human Genome Research Institute, this fall. I think that those applications were due in November, or coming up this November, for people to examine how we can improve clinical use of genetic testing across health systems. So work is being done to try to kind of speed this. I guess clinical inertia is what some people refer to as in the literature, this slow uptake of exciting new things.
Yes. Thank you for that. Thank you for that answer. Dr. Delphin Rittman, food is medicine and critical in maintaining health. Is there a program to include farmers and farmer markets and other types of assistance in helping people understand the benefits of real food and how to best prepare those to retain those nutrients necessary to address some of the chronic conditions that we see?
Yeah, that's a great question, because it's right on. I mean, food is central and critical to health, and we know, across the board, food has real cultural significance and cultural meaning as well. A program like that could technically be funded through our either mental health or substance use block grant. Those are fairly flexible funds, and in fact, through the American Rescue Plan, The block grant was increased by about $3 billion. So most states received quite a significant increase in block grant resources. The program that I mentioned, Food and Mood, does in fact get at that. And so it's pretty wide open in terms of what the grantees can put together to be able to address food as it connects to behavioral health. But increasingly, with our flexible funds, there are opportunities for grantees to implement programs like that. Also through the NED. So we have a network we call the NED, the National Network to Eliminate Disparities. It's a network of about, I think we're up to about 2,000 like awesome community-based organizations. And through the NED, that's a program I mentioned earlier where we're doing the Elevate CBO initiative. A program like that also could be proposed by a NED organization either to their state potentially, or as it fits with any other sort of SAMHSA grant initiatives. And something like that could fit within a number of different initiatives because we're really looking for innovative strategies to help to promote, behavioral health. So mental health or substance use wellness.
Great. That's great to hear. I know, and this really sort of goes to the funding, and I think that's what a lot of people are thinking about when they go to SAMHSA. Unfortunately, I know a lot of the funds that come from SAMHSA goes to those single state agencies. Are there any other vehicles in which communities can tap into those funds other than going through their single state agency?
Yeah. Increasingly, we have some of our grants that community organizations have been able to and can apply for. And so that is, there are some opportunities there that go directly to community organizations. But I hear that request. It's something that I've heard quite a bit in the short time that I've been in my role. And so it's certainly something that we're looking at. We have a number of grants that are tribal only grants and that go, directly to tribal communities. So it's something that we're, certainly hear that request. And so we'll continue to look at that. But I'm encouraged. I throughout my career have been a full believer in sort of unsolicited grant proposals. And I remember in my role as commissioner, sometimes the states just don't necessarily know the communities and the organizations that are out there. I often would have conversations with my staff and now with my SAMHSA team, having similar conversations around how do we reach who we're not reaching? And how do you reach groups who you don't know that are out there? And so that's a real, I think, funding challenge for philanthropists, for state government, how to get at innovation that's happening that we may not be aware of. So from that perspective, I'm a full believer. Some of my early grants were not grants that were called for. They were grants that I said, look, I got this good idea. And I just sent it. I sent it far and wide. And I'm a full believer that any good idea, somebody will pick it up. Particularly if you take a look at what are some of the priorities of either the state or the philanthropic group or even SAMHSA, and if the project aligns with those, then I think it's important to send those ideas along.
Okay. Well, thank you for that. And I think a lot of the folks, I see the nods from our team. I think a lot of folks will agree that oftentimes innovation is stifled by the mere processes that we bring along. Thanks again. I know we need to wrap this up. I'm going to once again thank the team. This information is going to be available for these sessions that are part of this conference. Thanks again to everyone for making this opportunity available to all of you and for those that are listening in today. Back to you, Carolyn.
Thank you so much, Audrey. Thank you for a fabulous panel, a panel of action and some action ideas. I want to also remind people to check out the chat. There was a lot of chat going on and suggestions of websites people should check out and questions that even the panel members might want to go and check out and follow up directly to the individuals who post the questions. It is time now for our break. We will break until 10:45. We'll probably call that about 10:50 as we're queuing up panel 4. And so again, you're watching the 13th National Conference on Health Disparities and the 2021 National Environmental Justice Conference and Training Program. We're happy you are with us and look forward to you continuing to stay with us throughout the afternoon. Thank you, everybody. We'll be back.
Bye-bye.
Welcome back, everybody. This is day 2 of the 13th National Conference on Health Disparities and the 2021 National Environmental Justice Conference and Training Program. We're happy to have you with us. We're addressing over the next few days health disparities, environmental justice, and shaping the future of healthcare. It's time now for panel 4, and panel 4 will be looking at climate change and climate justice. Climate change can and will have differing social, economic, public health, and other adverse impacts on underprivileged and underserved communities. This discussion will address these inequities and how to bring race, gender, income, and location to the center of the climate change discussion. It will also continue the dialogue on enhancing the relationship between health, environmental justice, and economic development, and how to improve the quality of life in challenged communities. I'd like for you to please welcome our moderator for panel 4. His name is Mr. Albert A. George II. He is the Director of Conservation at the South Carolina Aquarium, which is located in Charleston, South Carolina. Welcome, Mr. George, and I'll turn it over to you.
Thank you, thank you, thank you. I would like to thank all of our virtual participants, and I would like to thank this distinguished panel for this incredible discussion we're going to have today. And just as a couple of quick housekeeping related issues, I'm going to first introduce the panelists, and the introduction in which I make from first to third is going to be the order in which we're going to proceed with the presentations. I would also ask that the audience that if you have any sort of questions that you would like to ask the panelists, that if you could actually put those into the chat boxes, and then during the 15-minute Q&A that would come at the end of all of the presentations, we would be happy to entertain as many of those questions as possible. So without any further ado, let me introduce this incredible panel that we have today. First, we have Ms. Dana Johnson, who is the Director of the Federal Policy Office of We Act for Environmental Justice, coming from Washington, D.C. So if we could, let's welcome her warmly. Second, we have Dr. Kirsten Dow, who is Carolina Trustees Professor, Lead Investigator for the Carolinas Integrated Science and Assessment, CISA, University of South Carolina, and also serves as a NOAA Science Advisory Board member based out of Columbia, South Carolina. And last but not least, we have Ms. Nina Martinez-Berger, who is the managing member of Althen LLC, based out of Albuquerque, New Mexico. So without any further ado, I am pleased and have a great deal of joy to have Ms. Dana Johnson kick us off. And again, each presenter will have 15 minutes. Thank you so much.
Thank you so much for this opportunity to be with you today. As was noted, I am with We Act for Environmental Justice. We are a 30-year-old environmental justice organization that was founded in Northern Manhattan in New York City 30 years ago. Our mission is to ensure that people of color and people in areas of low income are able to participate meaningfully in the development and the decision-making related to environmental and environmental health policies and practices. We are the first people of color led environmental justice organization in New York State, and we are the only environmental justice organization to have a permanent presence here in Washington, D.C. Our advocacy, legislative, and regulatory work focuses on 11 areas, including environmental and climate justice, which we are going to talk about today. So there's a great deal that can be said about climate change, climate crises, and the justice work that we do in this space. I do want to acknowledge that this week we are commemorating the 30th anniversary of the first People of Color Environmental Summit, which was held in Washington, D.C. And I thought a lot about this summit as we lifted it up this week, as well as the principles of environmental justice that came out of that summit. And I want to share the preamble with you because I think it really speaks to climate change and the focus that I want to talk about today. And so the preamble that leads into those 17 principles says, we the people of color gathered together at this multinational People of Color Environmental Leadership Summit to begin to build a national and international movement of all peoples of color to fight the destruction and taking of our lands and communities. Do hereby reestablish our spiritual interdependence to the sacredness of our Mother Earth, to respect and celebrate each of our cultures, languages, and beliefs about the natural world and our roles in healing ourselves, to ensure environmental justice, to promote economic alternatives which would contribute to the development of environmentally safe livelihoods, and to secure our political, economic, and cultural liberation that has been denied for over 500 years of colonization and oppression, resulting in the poisoning of our communities and land and the genocide of our people. Do affirm and adopt the principles of environmental justice. And so when we think about climate change and we think about the climate crises, it really is centered in places where people of color, in low-income areas, and in indigenous spaces. We know that people of color in the US are 38% more likely to be exposed to asthma-causing pollutants from climate warming cars, from construction equipment, and from industrial operations across sectors, but specifically those related to fossil fuels. We know that African Americans make up 13% of our population, but 68% of us live within 30 miles of a coal-fired plant. Latinos make up 17% of the US population, and 39% of them live within a 30-mile radius of a coal plant. And when we look at toxic release facilities, Baltimore in particular, for a study that I recently read, 60% of African Americans and 70% nationally live within 2 to 4 miles of one of these polluting facilities. And then when we look at the impact of operations on natural disasters, and extreme weather events, the economic impact in communities of color and areas of low income is disproportionate. And so we talk a great deal about the connection between consumerism and the centering of the climate crises in our communities. And at We Act, we've been thinking about policy interventions. How can we reverse these trends? And it really boils down to our increased use of fossil fuels, including coal, oil, and gas, to generate electricity for various aspects of our lives, for manufacturing, for transportation, really do stand in the way of creating environmentally safe livelihoods, communities, households, and our nation. But we have a solution, and that is to transition our energy economy to less polluting sources. And there are 3 questions that we always try to ask ourselves when we think about what that transition should look like. And I borrowed these questions from Monique Harden with the Deep South Center for Environmental Justice. And she always says, does the production or use of this energy harm communities? Does it perpetuate racially disproportionate pollution burdens? And does it contribute to the climate crises? And if we can say yes to one or more of those questions, it is not an energy source that we as a nation should continue to use. And so I want to just wrap up my comments talking about economic stability as it relates to climate change, and thinking about all of those areas. There are 4: energy burden, education, poverty, and increased employment that can be positively impacted if we evolved our energy economy. So when we look at energy burden, we already know nationally low to moderate income households spend 30% of their income on housing. We also know that 2 to 30% of that pot of money coming into a household also goes to pay for energy sources. That is a tremendous burden. And so we really need to move toward using more affordable, less expensive to produce energy sources. And at WeAct, we have thought about this in two ways. The first is last year we released a green jobs report. And in that report, we looked at best practices for transitioning underemployed, unemployed, and even those who are currently working in the fossil fuel industry from where they are today to a new energy economy. And so we make best practices that include, wraparound services. We look at how we can provide educational opportunities that will bring a person's skill set up to what's needed for our evolution. And then we think about policy changes that can make this a simpler practice. So what legislation do we need to have in place to preserve pensions, for example, as people move from one industry to the next? We also have developed what we call a national education strategy that leverages the administration, the Biden-Harris administration, focus on renewing what they call the civilian climate corps, but we call it a frontline climate corps. And with it, we have been pursuing investments in making resources available for K through 12 education. So how do we begin to see the next generation of climate and environmental activists? We are looking at workforce development. So how can we more robustly develop, invest in work in training and development programs that can be scaled across the country? We look at the role of historically Black colleges and universities and minority serving institutions in training the next generation of professionals. And then also we want individuals to come back to their communities and really work to create these socially cohesive, vibrant neighborhoods and economically sound households. And so we have been proposing a fellowship that will provide a full year of salary and benefits that will allow an individual, once they graduate from college, to come back to their community and work in an organization like WeAct for Environmental Justice, or start their own as a way to really begin to transition and turn things around. So I will end my remarks there and look forward to being part of the conversation.
Thank you, Ms. Johnson. The information you provided is incredibly engaging, and I just want to hear more of that information. But again, in the expediency of time, we're going to move on to Ms. Kirsten Dow, the next presenter that you hear. Thank you so much, Ms. Johnson. We look forward to hearing from Dr. Kirsten Dow. Thank you.
Hi, thank you all. I'm pleased to be here and talk about climate and health disparities. Excuse me. I'm having a little trouble advancing my slides. So thank you. We recognize, as Ms. Johnson was just explaining, that the issues we're facing in climate change are coming on top of a legacy that is contributing to enormous disparities among Black, white, and Native American populations, and that this is an environmental justice issue. We know that the health disparities that we're seeing in our communities are driven by social and economic inequities in economics, in neighborhoods and education, in availability of food, in support for communities, and in the healthcare system. What I want to talk about today is how climate change will overlay that and potentially contribute to amplifying these inequities. The basic story of climate change you're probably familiar with. This is from the latest IPCC report, and each of these sort of red, these red symbols indicates where there's been a change in the hot extremes of temperature around the world. Similarly, the green here shows that there's been an increase in heavy precipitation around the world. This is already observed. We're dealing with it now. And I'd like to talk about both temperature and precipitation. Won't be able to touch on everything about climate change and health today, but these two things drive so many issues. So starting with heat. We're expecting increases in both heat waves and high temperatures that are going to cause mortality and morbidity. We know that the elderly and the young are most susceptible, but we also know that those with heart disease, diabetes, and respiratory diseases, many of those which are disproportionately affecting communities of color, those people are also more affected. Some of the medications that they use to treat these illnesses will also contribute to people's sensitivity to the growing heat. People who are active outdoors, many either athletes, farmers, construction, people who work in manufacturing, all of them, again, often people of color, are differentially exposed and suffer the stress of heat. And it's not just an urban issue. I want to point out that often we think about heat as an urban problem, but it's also been documented that there have been more emergency room visits due to heat in rural areas of North Carolina than in other parts of the country. And I want to especially call out the issue of pregnancy, because heat exposures over long period of times have been documented across the country to result in shortened gestational ages for children, and that comes with long-term health consequences for those children. Now, we're looking at projected changes in extremes that are larger in the frequency and intensity. This is kind of a busy diagram, and again, an IPCC document. But what you're seeing is that as we go from the baseline conditions on the left across to future warming levels up to 4 degrees Celsius, the event that has a 10% chance of happening any one year could be up to 5.1 degrees Celsius hotter. The event that has a 2% chance of happening any year could go from, at present, 1.2 degrees Celsius hotter to as much as 5 degrees Celsius hotter. Look at this across the United States. This is where we are with the baseline of days over 90 degrees. And you can see the pattern, sort of Mexico, California, Arizona. But as we move into the 1950s, look at those reds and oranges spread across the country to many other areas. We know that right now that the average person of color lives in a census tract in an urban area. Let me try this again. What we're seeing here is that the census tracts with higher urban heat island intensity are more likely to have people of color living there than non-Hispanic whites in all but 6 of 175 urban areas. So every triangle you look at with a black line around it is statistically significant. The rest indicate the same trend. And the pattern is similar for people living in poverty versus those 2 times above the poverty line. Disproportionate exposure. We know that if we look ahead to the costs of heating and the energy burden and the issues of poverty, that by mid-century we're expecting the change in cooling degree days to be concentrated across the South, in Appalachia, in many of the areas that are also home to large Native American reservations. And you can see that what we're highlighting here is that they're falling on top of areas with both urban and non-urban areas of persistent poverty. And that definition is poverty rates of more than 20% in a county persisting over 30 years. So there's going to be extreme impact on energy poverty burdens in already deeply affected neighborhoods and communities. Also wanted to point out that one of the changes we know that's taking place is that the nighttime temperatures are rising faster than the daytime temperatures. And this is maybe an underappreciated problem. But because what happens is that if you don't have the ability to air condition your house adequately, and you need to open those windows at night, you're not going to have that same opportunity for your body to recover from the stress. And we look here under the higher scenario in the upper left-hand corner. We see those temperatures growing to over 100 degrees in the Florida area, up to 150 degrees by late century under the higher scenario, and significantly into the 50, 75 days. So this is a very difficult problem. It doesn't allow people to recover from repeated outdoor exposure overnight, and those impacts can be cumulative. Changing heat is also going to contribute to changing air quality impacts, as you noted before. So we're going to see climate change is going to favor the formation of ground level ozone, difficult for people with respiratory disease. It's going to favor a longer growing season, and the higher CO2 levels actually encourage plant growth. So we'll have both higher pollen counts and longer pollen seasons. The resulting impacts are going to be felt on the respiratory and cardiovascular systems. We're expecting rise in asthma episodes, allergenic illnesses, and we know in just one set of statistics that African Americans are much more likely to have the asthma, to die from related causes, and to be admitted to hospitals. These are aspects of the exposure that can be changed. Switching to another important dimension of climate change, we're expecting an increase in the number of days with over 1 inch of precipitation. You're like, 1 inch of precipitation, is that a big problem? And you see that from the left to the right, the right-hand side shows it's a little bit greener in most of the eastern United States. It's a problem for a couple of issues. It's related to the increased intensity of rainfall overall. So we have more cases of urban flooding. This is a picture actually from a hurricane that was pumped up by warmer sea surface temperatures and the increased ability of the warmer atmosphere to carry more water. And so when it fell in North Charleston here, it brought with it substantial flooding. And we're going to have water-related illnesses that are going to contribute to the growth and the spread and the virility and the virulence and the toxicity of a variety of different bacteria and viruses and algae, potentially contaminating drinking water, recreational water, and potentially releasing sewage or chemicals from other human activities. Got people here wading through floodwater trying to deal with Hurricane Matthew. Charleston Post and Courier did a nice study of Hurricane Matthew in Charleston. They went out and they sampled the floodwaters during that time. And the samples that they found showed that the E. coli levels exceeded the state Department of Health and Environmental Control standard for recreational waters by as much as 60 times. Each of these red spots is a place where it exceeded recreational water standards. Now, why is the Post and Courier doing this? Why isn't DHEC doing this? They're not responsible for testing floodwaters. They test regular recreational waters. And, sometimes people are treating floodwaters like recreational waters. They're out in Charleston kayaking and surfing and who knows what else in them. But other times people have to be in these waters, but they are a health risk. And it can be something that we look at and begin to adapt and avoid these kinds of exposures. That increase of water, along with warm temperatures, is also going to increase the potential for vector-borne diseases. So if you're outside and working outdoors or working in the forests, the ticks that carry things like Lyme disease, some other pathogens, are more likely to be favored by these changing conditions. And the mosquitoes that carry West Nile virus, dengue, yellow fever, and other pathogens are also likely to be favored by these conditions. We're looking here at the current suitability for Aedes aegypti, which is the malaria carrying mosquito that also carries several of these other pathogens. And its prevalence right now is quite good, but the areas where it's been moderate to high or low are likely to begin to meet this mosquito more often. All right. But coming to this, I've talked about just 3 dimensions of what's happening with climate change and the ways in which it is going to place additional stresses atop of existing disparities. And not surprisingly, it's also going to contribute to stress and mental health disorders, depression, anxiety, and post-traumatic stress disorder if you've been through one of those major flood events, lost your home, or, as this happened in many places in the Carolinas where I'm from, people have been through this multiple times, and that's going to continue to be the case, unfortunately. We also know that this chronic stress, because of disasters or because other health outcomes are becoming worse due to climate change, is also going to contribute to mental health issues based on these threats and on the perceived experiences or perceived risks. And then finally, we know that if people have these existing mental health illnesses, many of them face additional risks from extreme heat because medication they take that they need to take may increase their physiological risk to heat. So where are we? We're at a moment where I talk about mental health, but I don't want to end this talk on that note. What I want to say is that we're in a situation where there are many opportunities to make a difference. We know that with every amount of global warming, changes get larger, but we know that we don't necessarily have to see the worst of these impacts. We can both work to, as Ms. Johnson was explaining, look to transition our energy economy, and at the same time, think about how we adapt current systems to promote health and safety of everyone. Thank you.
Dr. Dow, thank you for some riveting and great information. Definitely a lot for us to sort of consider as we think about both climate change and climate justice. So with that being said, our last presenter is going to be Miss Nina Martinez-Berger. I'm excited to have her here because she is an entrepreneur, and I am going to allow her to describe herself in the way she described to me how she would like to articulate herself on yesterday. So without any further ado, Miss Nina Martinez-Berger, we yield the floor to you. Thank you.
Thank you so much, moderator Al George. It was a pleasure speaking to you before we came on live. I really appreciate all the hard work you're doing and the fact that you are a recognized marine scientist and helping the aquarium in South Carolina. That's really important work as a conservationist. So I'd like to also thank my other panelists for being with me, and I'm honored to be here. I'm a socially motivated entrepreneur, as you mentioned, and we believe that doing good in the world through investment in intellectual property and commercializing the intellectual property for the public good, that is our overarching theme in our companies. That overarching philosophy carries through all that we do. What my family does is we identify intellectual property that can be commercialized so that it is in a way that's socially responsible. So that is all of our investments are focused on that. Today, my presentation is going to discuss the adverse health consequences that catastrophic fires have on our, not just locally, but also on our entire nation and the world. and the damage to our environment that PM 2.5 particulate matter is specifically that is emitted through wildlife smoke, the adverse consequences that that has on our nation. Finally, my presentation will conclude with the specific adverse effects of the proliferation of wood pellet production facilities, especially in the southeastern part of the United States. So I would like to have the next slide, please. This is a MyRadar snap that was taken off of the National Oceanic and Atmospheric Administration just yesterday. And what this map shows is that wildfires are not just affecting the western part of the United States. As I discussed 2 years ago in Oakland, California, at the National Health Disparities Conference there, when I picked the same MyRadar snap, what it showed was that the western part of the United States, you would have seen all the orange fires. The orange denotes where there are active fires actually today, since this was yesterday. And now, if you look at the wildfires, they are now in the Midwest. They're pretty spread out in the Midwest, also in the southern part of the United States also, and then the few up in the eastern part, just north of our neighbors in Canada. There are some fires there. So what I wanted to discuss was wildfire smoke. And next slide, please. Wildfire smoke contributes to more deaths in the eastern United States than in the West. A recent study that was reported again in a very timely way, October 21st, so this was a week ago, and was written by Rachel Ramirez of CNN. And what we're seeing now is this year we are finding that the wildfires that are emitting and have been ignited in the West, that the smoke due to the airstream is traveling east. And I think people in Philadelphia and New York experienced this, but there were red skies and there were very odd looking colors in the sky. That was actually smoke from the wildfires in the West. And the particulate matter, the particulate matter 2.5, that is especially troublesome because it is so fine that it gets into your lungs. So just going into this recent study in the Journal of GeoHealth, this data is so recent that probably academic data has not caught up with the recent events in smoke events that we've had in the last few months. But I just like to cite this Journal of GeoHealth article where they did find that wildfire smoke has led to 6,300 additional deaths a year, and 1,700 of those deaths were in the West. So as you can see, the vast majority of those deaths were not in they were elsewhere throughout the country. So smoke is not just a Western problem for Western states to worry about. We've heard a lot about California and the drought conditions and the catastrophic fires in California, but the airstream takes that smoke and that particulate matter all the way to the east. So smoke is not just a Western problem. It has real health implications for our large population centers in the east. And from the West Coast, as I said. So just quoting from this, let me see, wildfire smoke carries fine particulate matter, that's the PM 2.5. And when it's inhaled, it goes deep into your lung tissue. And it actually, which is little known, but it can actually enter your bloodstream. So it's especially dangerous and causes health complications such as asthma heart disease, chronic bronchitis, and other respiratory illnesses. So researchers have analyzed the number of visits and hospitalizations resulting from smoke-related PM 2.5 from 2006 to 2018, and found that while the generally experiences lower smoke concentrations than the West, it still has the higher population density. So the number of emergency room visits is. You see, okay. The second point on this slide is, although the majority of large landscape fires occurs in the Western US, the majority of deaths, 74%, and asthma emergency room visits and health hospitalizations, 75% are attributable to smoke occurring outside the West. Next slide, please. So one thing to look at is, as we look at, well, how can we address this issue of the catastrophic forest fires, and why are we having more catastrophic forest fires than we've had in the past? If we look at California and the West Coast, obviously the drought conditions in California and the West Coast have created a tinderbox situation. They have a large, massive area of trees. And what happens is, if you're a business person, you look at what is economically viable for me to do? What can I do in what can I utilize in terms of the forest for your commercial entity? And when trees are taken from the forest, and we now that trees do need to be thinned. One issue that we have faced is that the trees in our western part of the United States are not trimmed, and there was a lot of adverse reaction to trimming any tree. But now we know that for forest health, you have to trim trees, otherwise you create a condition, a tinderbox for the forest, what is on the forest floor. And these are the bark, berries, leaves, and needles. Those are, when those are taken down and harvested, those are left on the forest floor because they're not commercially viable. So a company, they'll buy the trees, but they lop these the tops off and the and leave them on the floor. So when you have an unplanned lightning strike, which obviously occurs in nature, you basically turn a fire that you can contain into a catastrophic fire that continues to burn for days and weeks, and sometimes even months. So the prescription treatment is really to take that, what's been lopped off from the trees, and to use that in a clean and green product. Currently, there are approximately 7 billion standing dead trees in the United States forests. So you have between 6 to 10 inches in diameter. So these trees are lopped, and as the drought conditions worsen, and they create that forest fuel that lights those fires and turns them into catastrophic fires. Standing dead trees are the result, as I said, of the bark beetle, and then fire, lightning strikes, and natural mortality. Next slide, please. Okay. Okay. One point to make is that there are wood pellet facilities in the Southeast United States, and this is an issue that's come about just recently because facilities were touted as being carbon neutral. In fact, the UK have been giving subsidies for studies that show that these facilities are carbon neutral because they want to burn the pellets and use that as an energy source. And this energy is actually extremely hazardous and dangerous to health because it emits 2.5. So wood pellet production facilities are similar of harmful particulate matter, the PM 2.5, airborne pollutants, carbon monoxide, carbon dioxide, nitrogen oxides, sulfur oxides, and they degrade the local quality, water quality, and the air quality. And as I said, the wood pellet production is increasing rapidly in the southeastern United States because the EU and the UK, the pellets, and they think that they are carbon neutral when actually they are not. Next slide, please. In fact, the NEJC has found that African Americans who live near biomass power plants are more likely to suffer from increased exposure to a number of these dangerous emissions, such as smog, asbestos, sulfur dioxide, other toxins, than any other racial group in the United States. And the wood pellet production facilities in North Carolina are located in counties where at least 25% of the population is below the poverty level. I wanted to also point out an article in the Guardian, which is a UK paper, which is finally catching on to the adverse effects caused by pellet production facility. And they point out that the wood pellet production facility in Hamlet, North Carolina, has caused early adult onset asthma, obviously asthma in children too, but adult onset asthma is pretty rare. Asthma when they're younger based on their environment. But as these facilities have gone up, there are 22 facilities in the southeast states that have gone up, and not that many years, the last few decades. And asthma, nosebleeds, lethargy, and breathing problems in general are a serious these communities. Next slide, please. This picture that you see on the left shows the degradation of the forest landscape from taking the trees to then process in a very, I would say, it's a high energy and a dangerous industry, really, so that these commodities on the right can be produced and shipped mostly to the UK and the EU. So this is a situation that needs to be addressed in more of a broader sense, in that the US we're denuding our land, and we are causing pollution in our communities, and especially in the southeastern United States. Most of the the pellets to the EU, to outside the United States and the UK. Next slide, please. As we've discussed, we've discussed that this is a dirty business, and the American Lung Association and the Heart Association are opposing additional wood pellet production facilities in the United States because of this dirty business. It's causing breathing problems, nosebleeds, and asthma. This picture shows in the middle what's being emitted there. That's steam, and that's fine. But as you can see, all of the other trees and wood products that are surrounding the facility, they emit the PM the 2.5. So I just wanted to summarize that with the recent fires, the particle pollution in the Bronx and Brooklyn is up to 20 times higher what it was recorded prior to the state monitoring their air quality. And wildfire smoke in historically marginalized communities, and coupled with these wood pellet production facilities, are creating a real toxic blend for the local communities and the people in those communities. And some of the solutions can be that, as a policy standpoint, we should be looking at policies that encourage the taking of the forest fuel from the floor to turn that into commercially viable businesses. Also, the economic synergy between business and governments needs to be looked at, because there needs to be communication between businesses, commercial businesses, and the government and local community organizations. And also, finally, just encouraging students who are underrepresented in the environmental sciences to get degrees and to participate in the whole discussion of the partnerships between business and the community and government. Thank you.
Thank you so much, Ms. Berger. What a great presentation. We would like to thank again Ms. Dana Johnson, Dr. Kirsten Dow, and again, last but not least, Ms. Nina Martinez Berger, for their great presentations. With that being said, we do have some questions that are in the chat box. And the first question is actually coming from Mr. Ian Pope, and his question is simply to the panelists. How do the panelists use publicly available data, like from the US EPA, EJ Screen, and other state-based tools, to really inform the potential impacts of these related sort of drivers of change on marginalized communities? And so he was just interested in how you're using these publicly available data sources to sort of infuse your work with sort of a better understanding that would lead to better solutions. And again, if any of the panelists or all of the panelists would like to respond, I yield the floor to you to respond to that question.
I'd just like to say that this is Nina Martinez Berger. I'd like to say that in looking at this data, you have to have a skeptical eye, because the wood pellet production facilities and the businesses behind them have been using monies from the UK, funded by the UK and the EU, to promote these wood pellet production facilities as carbon neutral, and that isn't the case. So even though you have to be skeptical of the data and question, where is this data coming from, who's funding it, and why?
Any of our other panelists who would like to respond to that question from Ian Pope? If not, we have.
Go ahead.
Go ahead.
Okay. So I do think that data like the EJ screening tool used by that's produced by the Environmental Protection Agency can be really instrumental in articulating the pollution problem in communities. I know, as an example, it was really instrumental in the Gulf Coast region in helping to show the correlation, the connection between the amount of pollution that existed in what we now call Cancer Alley, for example, and cancer rates, asthma rates. So that toxic release data, I think, can be quite valuable in pressing for what we talk about a lot is stronger environmental protections and a stronger regulatory environment.
Excellent. Any other responders? Dr. Dow, would you like to respond to that, or would you like to move to the next question?
I'd just say I think it's a great question that we look at the EJ screen, we look at many of the different social vulnerability indices that are available, and that we also take those apart and understand that when you aggregate things, you may miss key factors in the underlying patterns. So use them, but also look at the components of them individually to better understand the specificity of the context.
Excellent.
Yeah, it'll be, yeah.
Thank you so much for your responses. The second question that we have is from Brandy Crawford Johnson, who is a researcher from Kalamazoo, Michigan, who is currently conducting toxicity research in relation to graphic packaging. And basically her question is, you have research studies that are kind of done sort of given a funding source. The question that she has is, do you think that we will see any significant shifts in how these related projects that are sort of assessing risk impacts on underserved communities, do you think we're going to see more funding come, or is it going to always be the domain that the activists have to continually to advocate and to, agitate to receive more funding and more getting away from a reactive stance to a proactive stance? So her question is, do we think we're going to see a paradigm shift and how studies are conducted for marginalized communities looking at these risk factors?
Dana, you're in Washington.
Well, yeah. So I was going to say, I think that we started this this new administration. We started this session of Congress with this idea of centering environmental justice in the operations of our federal government. And so that looks at agencies and departments. It looks at programs within all of them. And there are charges to look at the disproportionate impact of the climate crises, to look at, even I think that question even related to toxic chemicals that we find in packaging that are just part of the production process. I think that there is great desire, but I will say to you, just as today, we got the framework for how we would address the climate crises. It's not as robust as we would like for it to be, and it doesn't always meet the scale of the problem. But I do think that there is a will, there is a desire for us to do better. Yeah.
Any other panelists who would like to respond to the question?
This is Nina. I'm a big proponent of regional and local solutions to problems, because if you look at the wood pellet production facilities, they're located in the southeastern part of the United States. And I think that region could get together, coalesce around this issue, and then work with the localities and take it down to a community level. Because the federal government is the federal government. I think that they're good in terms of gathering data, setting broad policy, but where the rubber hits the road are in the localities and the communities and the regions that are adversely affected. And I think they have to lobby for their own quality, good quality of water and air and environment and forests, clean and healthy forests and robust ecosystems that support our plant life and animal life in a general sense.
Thank you. And I know, Dr. Dow, that you actually work on several unique community-based, state-based related programs through CISA and through all of your great work. And do you have any specific points that you would sort of elaborate on, or maybe how do we build the systems that could attract or help advocate for these type of resources reaching underserved communities more proactively?
Yeah, I think that we need to make it really clear that these issues are out here and continue to raise them up. It's so easy to get drowned out by entities that have more resources, whether it's fossil fuel companies or some other agenda that seems to just push fundamental health concerns off the day-to-day news. Maybe people say like, yeah, you know, there gets to be, it needs to continue to be a focus. And I think doing things like heat watch mapping, I was part of a really nice program that NOAA supports where community scientists actually map the entire city of Charleston to see where the hot spots are. And the city of Charleston's committed to following up and addressing those places. And, you know, as Ms. Berger was saying, the local, right? We need to take those opportunities to illustrate where we have opportunities to act locally. And that was one particularly nice opportunity. And I'm happy to say the city of Columbia wants to do that now, since they saw that. And I hope that maybe some other people are interested and it becomes more prominent.
Well, excellent. This has been an incredible, I've enjoyed all of you. I've enjoyed listening to all of your perspectives. The key takeaway for me is that we have a lot of different fronts of activity that are concerning, but there are opportunities, right? With every challenge, there are opportunities, whether it's in the entrepreneurial ranks, whether it's in the policy advocacy, or whether it's in the scientific ranks. So how do you better connect the science to the communities, to the activists, to the entrepreneurs that would help them make the needed informed decisions? So without any further ado, I want to turn this back over to our fearless leader to take us home. Thank you all for your incredible inputs. Thank all our virtual guests for participating. And thank you for an opportunity for us to consider these most pressing issues.
Welcome back. I'm Carolyn Sawyer, and this is the 13th National Conference on Health Disparities and the 2021 National Environmental Justice Conference and Training Program. We have been spending the last 2 days addressing health disparities, environmental justice, and shaping the future of healthcare. Our next panel, which is panel 5, deals with federal Title VI and environmental justice. This session will be a panel discussion with federal civil rights offices engaged in Title VI enforcement and compliance work related to the environment and health that are receiving federal financial assistance. You're going to hear from representatives from the U.S. Environmental Protection Agency, the U.S. Department of Transportation, the U.S. Department of Homeland Security, the U.S. Department of Housing and Urban Development, and the U.S. Department of Health and Human Services. So we want your full attention, as there is a lot of wonderful information you're about to hear. And I'd like to turn it over at this time to one of our favorite moderators and good friend to the conference. Welcome back, Daria Neal. We welcome you. He's the Deputy Chief of the Federal Coordination and Compliance Section in the Civil Rights Division of the U.S. Department of Justice in Washington, D.C. That's a mouthful, but welcome back, Daria.
Thank you so much, Carolyn, and thank you everyone for joining us today. And as Carolyn mentioned, I'm a Deputy Chief in the Civil Rights Division of the U.S. Department of Justice. And as you know, over the last year and a half, it has been one of the most challenging periods for our country in recent history. And we're slowly emerging from a global pandemic that has disproportionately impacted African Americans, Latinos, and Indigenous populations. And we know these same communities have been bearing the disproportionate burden of environmental pollution. The connection between race and pollution is well established and beyond dispute. For example, a 2017 report from the NEJC and the Clean Air Task Force established that African Americans are 75% more likely than other Americans to live in fence-lined communities near facilities that produce hazardous waste. An EPA study published in 2018 examined the racial and economic makeup of communities around facilities emitting air pollution. It found that African Americans are exposed to 1.5 times as much air pollution regardless of income. Now, as many of you may know, President Biden has issued numerous executive orders to date. Many strike a common theme: the need to address racial inequities and the climate crisis. The whole of government approach of this administration mandates us to look holistically at these issues. The layers of inequities, pollution, lack of clean air, lack of health care, are not felt separately by real people. In our lived experience, these layers work together and have devastating cumulative effects. The President's executive order on tackling the climate crisis at home and abroad created a new White House Environmental Justice Interagency Council which is charged in part with making recommendations to revise the 1994 Executive Order on Environmental Justice. Additionally, the President's Executive Order on Advancing Racial Equity and Support for Underserved Communities through the federal government has charged federal agencies to address barriers in our programs to racial equity. And so one of the major goals for government-wide enforcement of Title VI of the Civil Rights Act of 1964 is to improve coordination and address these issues together. Title VI prohibits discrimination on the basis of race, color, and national origin in programs and activities that receive federal financial assistance. And this includes programs that relate to or impact the environment and human health. The Department of Justice is responsible for coordinating the implementation and enforcement of by executive agencies of Title VI and other non-discrimination statutes. And to that end, the Civil Rights Division is responsible for the overall coordination in identifying legal and operational standards and ensuring consistent application and enforcement. We continue our leadership on the Title VI Committee of the EJ Interagency Council, and through that committee, we are working with the agencies represented here today to improve coordination of enforcement of Title VI enforcement and compliance efforts to advance environmental justice. Each federal agency extending federal financial assistance has primary responsibility for enforcing Title VI with respect to their own recipients. So as you heard today, we have representatives from EPA and the Departments of Transportation, Health and Human Services, Housing and Urban Development, and Homeland Security. Many of you participating today may have attended the National Environmental Justice Conference earlier this year and heard from our agencies that are represented today share their early priorities. So what we plan to do this afternoon is to provide updates on what our agency's priorities are and efforts to strengthen Title VI compliance and enforcement to advance environmental justice. If you have questions, please place them in the chat box. And after each of our representatives speaks, we'll open up the session for Q&A. So first we will hear from Lillian Dorka, Director of External Civil Rights and Compliance at the U.S. Environmental Protection Agency, followed by Carla Carter, Associate Deputy Director in the Civil Rights Division in the Office for Civil Rights at the U.S. Department of Health and Human Services, followed by Amy Vance, Director of Enforcement in the, Title VI Coordinator in the Office of Civil Rights and Civil Liberties at the U.S. Department of Homeland Security, and then Lynn Grosso, Director of Enforcement in the Office of Fair Housing and Equal Opportunity in the Department of Housing and Urban Development. And finally, Yvette Rivera, Associate Director for Equity and Access Division in the Departmental Office of Civil Rights at the U.S. Department of Transportation. So with that, I will turn it over to Lillian to kick us off.
Thank you, Daria. And it's great to be back, friends. Last we visited, I think it was May, we presented some overarching principles in terms of structuring our priorities at EPA with respect to the strengthening of our civil rights program. I think I have a slide. Yeah, there you go. Since then, much has happened. When I last engaged with all of you, I let you know that the administrator, the EPA administrator, Administrator Regan, had issued an email, basically a memo, to all EPA staff about the fact that environmental justice was to be a priority at EPA. And he directed all of us to look at environmental justice as well as civil rights, and to look at our programs, our whole program, and determine how we could, not whether, but how we could and we would integrate environmental justice and civil rights principles into all of the work we do. Since then, on October 1st, the administrator actually sent out a draft strategic plan for public comment. And I'm so excited about this because it's very unprecedented what you'll see in that strategic plan. And I hope all of you will take the time to look at that. There is a goal in there, goal 2 of the strategic plan, that is actually about civil rights and is titled, Take Decisive Action to Advance Environmental Justice and Civil Rights. This is unprecedented. Never in the history of EPA have we had a strategic plan goal that is specifically centered on the integration of environmental justice and the strengthening of civil rights enforcement. It asks all of us, not just the Office of External Civil Rights and not just the Office of Environmental Justice, but all of us at EPA, to take a whole of government approach within EPA to integrate and to ensure that all of us are not just integrating EJ into the work we do, but it makes very clear that civil rights is everyone's responsibility at EPA. We'll hope you'll take a look at this. The comments are due in by November 30th. If you have any problems, any concerns in accessing that, please contact me. Please contact us at EPA and we will make sure that you have access to that. Next slide, please. So how have we at External Civil Rights been strengthening? I don't think the slide advanced, did it? Okay. Unfortunately, it didn't advance. Okay, well, if you would have seen my second slide, it was a wonderfully beautiful slide. And what it talked about was the fact that we are strengthening. We are taking measures to strengthen our program in some very, very critical areas. In addition to working very closely with the Office of Environmental Justice, there it is, to make sure that we are integrating both EJ and civil rights into all of the work of EPA. We are taking some very specific measures to strengthen the civil rights program specifically. So our timely, of course, and effective investigations of complaints are critical. They're still critical. That is non-discretionary and critical for us, and we're committing to continuing to improve that process. But in order to be most effective, you're going to see a little bit of a shift, not a little bit, probably a lot of it of a shift from a reactive posture of only addressing complaints that come to us to a more proactive civil rights compliance activity-focused agenda. This will include affirmative compliance reviews in environmentally burdened and disadvantaged communities. And we are currently doing that level of planning. Most of you are probably familiar with the fact that on September 20th, ECRCO, our office, responded to some very, very pointed recommendations made by EPA's Office of Inspector General. And we responded to those. We responded in a very thorough manner, including with specific deliverables and identifying specific quarters within the next few fiscal years when we will actually make those deliverables a reality. So by the end of this fiscal quarter of fiscal year 22, so by the end of December, we are going to be launching our first compliance review. We've also made a commitment, a very, very public and visible commitment. It's gotten a lot of interest from the press to issue some guidances that are critically important. First of all, the first guidance you're going to see prioritizes the release of a Dear Colleague and guidance, and it emphasizes the need for EPA recipients to operate in compliance with foundational non-discrimination program requirements, because before they can begin to address any other more critical civil rights issues, our recipients need to acknowledge and have in place their own non-discrimination programs so that they can be responsive to the communities they serve. That document is slated to be issued by the end of December as well of this year. The second document, which has been getting a lot of attention, of course, is the guidance that we will issue to clarify and strengthen some already existing guidance about our civil rights, our civil rights analysis, and most prominently with respect to disparate impact. We're going to be talking about disparate impacts under civil rights law, and including in there, for example, a look at cumulative impacts, and specifically with respect to the permitting process. Now, contrary to what you may read in some sources, we are working with and will continue to work with states, particularly the Environmental Council of States, ECOS, as we develop that guidance, as well as other external stakeholders, and certainly with our own EPA experts, our program and regional offices, as we develop that critical guidance. What does it mean? What does disparate impact, and what do cumulative impacts within the permitting process look like? And how do we analyze those using our civil rights statute and our civil rights regulations and that analysis? But we will absolutely be coordinating and seeking advice and thoughts from all of our stakeholders, states, as well as communities and advocates. Anything else would be irresponsible. Along with that, we'll be issuing, along with those Dear Colleague letters, obviously, especially the first Dear Colleague letter, we're going to be launching a series of we're going to systemize our internal pre-award review process. We are looking at that right now, and if you look at the OIG response, you'll see some very, very specific efforts that we're making in that respect to ensure that the folks who we give EPA money to are in fact complying with obligations under the most basic even of obligations under our civil rights non-discrimination regulations. And of course, we're going to launch those compliance reviews, those post-award compliance reviews, especially with respect to underserved and critical areas. In addition, we're also working to increase transparency of our work. As a first step, for example, we now have posted a link on our ECRCO webpage that includes a very comprehensive chart of all of the complaints received since 2017, fiscal year 2017, to the present. That's just the first step. We're going to continue to update those charts. We're going to add prior years to those charts, and we're working to link documents, actual documents, such as the actual complaints received to those charts. And of course, critical is meaningful engagement with our stakeholders. Yesterday afternoon, we had very exciting for me, after 34 years of working in the civil rights area, we did and had the first public engagement session at EPA ECRCO that we've ever had. It was a 2-hour listening session. It was less about reporting what we're doing and more about we want to hear what you think we need to do to strengthen our program and to increase our effectiveness. You know, environmental justice and civil rights, especially Title VI enforcement, is critical to environmental justice. So what do we need to do to get us there, to this very, very lofty and noble mission that we have to ensure the protection of human health and the environment for everyone, not just some in our country? We're partnering, as I said, in just unprecedented measures with the Office of Environmental Justice, to take, our programs on the road. We've done internal training for the Office of Water, for the Office of Air. We're continuing to do that internal training to make sure that the integration of EJ and civil rights is real and that it's understood at every level within EPA, at every program and regional level. Finally, we're strengthening our interagency collaboration, as you can see. And I have to say, well, let me say this about that. I've never in my 34 years seen my friends, these folks on the screen, as much as I have now. My DOJ colleagues and my interagency colleagues, we are now just permanent fixtures on each other's computer screens. And we coordinate as never before. And we are taking on these very critical, very difficult issues. How do we conduct this coordination in a way that makes sense, that doesn't squander our very, very small resources that we're looking forward to increasing, but we're not there yet. We're all suffering from under budgeting, under staffing. And so how do we carry out this coordination in a way that maximizes input, takes full advantage of our resources, and leverages the impact that we have on each other's programs? We heard Daria at the beginning talk about this time of reckoning right now, right? If not now, when? This is when we're called to act. We have a window here where we can really make a difference. The time is now. We take this very serious. We're making what I think is very bold progress within our means right now, and we hope to even increase that. But to make a real and very importantly, sustainable difference in addressing environmental justice. We don't want this to be a once and done. We want this to be sustainable. We want this to be around long after most of us on the screen have retired and gone into our, environmental justice nirvana worlds, because everything is so much better for the most overburdened, the most disadvantaged communities. This is not lost on us, this great opportunity right now. And we're making our commitment to you that we will not relent on this. Thank you all.
Thank you, Lillian. And now we'll hear from Carla Carter.
Hi, everyone, and if you'll just give me one moment to pull up my presentation. I'm not sure if folks are able to see it.
Not seeing them yet, Ms. Carter.
Okay, hang on one second. We were doing so well a few minutes ago, right? I'll try it one more time. Anything yet?
No, ma'am.
Okay, well, I'll keep trying, and in the meantime, I'll start talking. Good afternoon, everyone. My name is Carla Carter, and I'm the Associate Deputy Director for Civil Rights within the Office for Civil Rights. Oftentimes when we think about environmental justice, we know the impacts of the health impacts for the community. And I want to share today, more than ever, the commitment of the HHS Secretary to address EJ issues, as well as race and health equity concerns for many underserved communities. So I didn't present with you guys back in May, so forgive me if I give you an overview of the Office for Civil Rights, because this is where I work, and I want to talk about that before I get into some of the larger issues that HHS has taken on. So the Office for Civil Rights is the law enforcement arm of the U.S. Department of Health and Human Services. We are responsible for ensuring compliance with certain civil rights, conscious and religious freedom, and health information privacy and security laws. Our office investigates complaints, conducts compliance reviews, promulgates policy and regulations, and provides technical assistance in public education for the American people. Like many of the civil rights agencies that are represented on this panel, we have 12 offices located throughout the United States, and we have, I'm sorry, hang on one second. I think I may be back on camera now. I don't know what's happening. I have some great slides, I promise you, but I'm good looking, so I will allow you to take all of this in. So, as I was saying, like many of the civil rights agencies, OCR has offices throughout the United States in 10 regions, because we actually have 12 offices. And so, in addition to our Title VI authority, OCR also enforces a number of regulations and laws that prohibit discrimination on the basis of race, color, national origin, age, disability, sex, and sex by entities that either directly or indirectly receive our funds, as well as our jurisdiction over state and local government entities. Many folks may not realize that HHS gives billions of dollars to public health agencies who are primarily responsible at the state level to respond to the health impacts of environmental justice issues. So you can understand our interest in this space and also our willingness and necessity of partnering with the EPA as well as DOJ and all of our other panelists that are here today. In addition to funding public health agencies, we also fund towns and villages that may receive a variety of funds to implement health programs. So through OCR's complaint and compliance review process, we investigate allegations of discrimination to identify violations of law. We provide technical assistance to help entities come into compliance. And then we also take matters to enforcement when we're unable to achieve voluntary compliance. So that was my pitch for the Office for Civil Rights. And I would hope that as you are thinking about how you can best serve your communities, that you would also think among all of the tools that are available, look to the Office for Civil Rights as a partner in this space. So one of the exciting updates that I can provide from HHS is that on August 30th, the Secretary established for the first time the Office of Climate Change and Health Equity. Their mission is to protect the health of the people of the United States in the face of climate change, especially those experiencing a higher share of exposures and impact. The Office of Climate Change serves as the department's hub for climate change and health policy, programming, and analysis, all in pursuit of environmental justice and equitable health outcomes. Some of the priorities of the office include identifying communities with disproportionate exposure to climate hazards, addressing health disparities exacerbated by climate impact, and exploring opportunities for strategic partnerships to support innovative programming to address disparities in health sector transformation. The senior advisor for that office is Arsenio Mataka, who many of you may be familiar with the advocacy he had done in the state of California, and the interim director is Dr. John Balbus. So the thing that I'm most excited about with the Office of Climate Change and Health Equity is that they've recently established a HHS Environmental Justice Unit that is head up by Arsenio and members of the CDC who bring years of experience in this area. And so their primary focus is to collaborate on interagency environmental justice committees. They're working to identify immediate and long-term priority actions to help disadvantaged communities. They're responsible for coordinating the annual HHS environmental justice reports. And then obviously we're close to 2022 and they're developing the HHS strategy to address environmental justice in health. One of the things that I think is particularly important is that the EJ unit has reached out to OCR to see how we could best work together to provide a wraparound response to concerns that we often see in the paper, but we may not at HHS receive as a complaint. And so what this allows us to do is, from the Office for Civil Rights perspective, is to investigate complaints or initiate compliance reviews based on information that we've received, as well as we're really hoping to engage our HHS partners in initiating an immediate public health response to the activities that are waiting on the ground. We know that EJ issues are longstanding and it's difficult sometimes to get resources in place at the right time. But what we can do is use and marshal and leverage HHS programs who are already on the ground to do some work with the communities. So I'm going to try just one more time because I really feel like you really should see these fantastic slides. Hang on one second. Did anything show up yet?
Oh, it looks like we're in progress.
Okay.
Maybe if you put it in slideshow mode.
Okay.
Yes.
Okay. Thank you. Look at that. You've got a new job area. I'm just going to move right ahead. And so some of the planned activities for the EJ unit are to provide education and training to disadvantaged communities. They're planning to conduct listening sessions that build on existing partnerships within HHS, like our Regional Health Equity Council, and stakeholders that participate in those roundtables and councils are state and local government officials, tribal entities, regional health system leadership, community members, and advocates. And then, of course, there's their general partnerships within HHS. And as I mentioned, OCR is really looking forward to partnering with the EJ unit. So in preparation for this presentation, I reached out to my colleagues because I know that many agencies have fancy graphics. I'm not a graphic person, but we've got some good partners within HHS. And so this is an infographic that our colleagues over at the Assistant Secretary for Planning and Evaluation developed to show the intersection of environmental justice and human services programs. So it presents key facts about how participants in human services programs are particularly affected by environmental injustice and the ways in which the human services can help mitigate the effects of environmental issues, including climate change. In addition to this resource, the CDC has launched an environmental justice dashboard that explores data on environmental exposures, community characteristics, and health burdens. And so I really invite you to look at all of the resources that HHS makes available on its website and to figure out ways in which you can use some of this data to help improve outcomes for people in the community. And so my last slide is how to get in contact with the Office for Civil Rights. I provided a link for the Office of Climate Change and Health Equity, and that will be updated fairly often. There is a link for the CDC's Environmental Justice Dashboard and the infographic that's been made available by the Office of the Assistant Secretary for Planning and Evaluation, and then just a host of other resources that HHS makes available. And if I haven't stressed it enough, as Lillian mentioned, we are in different days, and the commitment across government is quite refreshing to see how we are partnering, using our various areas of expertise to build upon the expertise of others. So thank you so much, and I will turn it back over to you, Daria.
Thank you so much, Carla, and I'm glad that we were able to get your slides up. So now we will hear from Amy Vance from the Department of Homeland Security.
Thanks, Daria. And I don't have any slides, so I will try to be as enthusiastic as possible. I am excited to be here and to be able to share some information on the Department of Homeland Security's environmental justice priorities and some of the actions that we've taken this year. So just to start off, I'm going to kind of follow Carla's lead and talk a little bit about some background on our office and how the environmental justice program is set up at DHS. So I'm Amy Vance again. I am the Title VI coordinator in the Department of Homeland Security Office for Civil Rights and Civil Liberties, or CRCL. CRCL is the headquarters civil rights office for the Department of Homeland Security. And as one of our functions, we implement a recipient civil rights compliance program. And this is to ensure non-discrimination in the department's federally assisted programs and activities, so our grant programs and activities. CRCL also co-leads implementation of the DHS Environmental Justice Program. And we do that with the DHS Office of the Chief Readiness Support Officer, which is another office in DHS HQ. So the DHS EJ program, it looks at environmental justice considerations in the department's own programs, policies, and activities, as well as those of our federally assisted recipients. And that's what I'll focus a little bit on in my remarks. This is where CRCL's EJ work is focused, ensuring that department recipients that carry out programs and activities that affect human health and the environment do not discriminate on the basis of race, color, or national origin, including language, in violation of Title VI. So just to give some context on the department's federally assisted programs, DHS provides billions of dollars each year in the forms of grants and other types of assistance to over 3,000 non-federal entities. This number has actually ballooned during the pandemic because we were providing a lot of assistance related to that to many more entities than we normally provide. But just some examples of our recipients, DHS funds state, local, tribal, and territorial government agencies, including Homeland Security and emergency management agencies. We fund local fire departments all across the country, port and transit authorities, law enforcement agencies, colleges and universities, nonprofits that provide direct services, and even state fish and wildlife agencies. So quite an array of recipients with all different types of implications for their programs. Environmental justice considerations may arise in DHS recipient programs that affect human health and the environment. An example that I wanted to just point out is the department's Chemical Stockpile Emergency Preparedness Program. So this program provides federal financial assistance to support states in carrying out emergency preparedness activities in communities where a chemical stockpile is located. And another, of course, very apparent example, very timely, is the COVID-19 vaccine distribution activities that are supported with federal financial assistance from DHS and other agencies. So as DHS funds programs that affect human health and the environment, we have a responsibility and an obligation to ensure non-discrimination in these programs. Now I wanted to just share a bit about over the past 9 months, the concrete actions that we as a department have taken to expand the department's focus on EJ, and in particular in the context of our federally assisted programs and our civil rights enforcement. At CRCL, we are expanding our federally assisted civil rights compliance program. And we're increasing capacity in a number of areas. And I think this is sort of, I'm echoing what my other colleagues have said as well about their programs. So we're increasing capacity in conducting in-depth compliance reviews, complaint investigations, training and technical assistance to our recipients, and data collection. And I just want to take a moment to expand on the data collection piece. We've recently implemented a new requirement for DHS grantees to provide to us, the Civil Rights Office, at the time of award, data on their civil rights complaints. And this includes those complaints raising EJ concerns, as well as copies of their recipient civil rights policies and procedures for their external facing programs and activities, including those that affect human health and the environment. So our office, along with our partners in FEMA, we review this information coming from the recipient organization, and we provide detailed feedback to the recipient to address gaps and insufficiencies in their civil rights program. So this requirement is called the Civil Rights Evaluation Tool. And, it really enables us to collect data from our recipients and to conduct a preventative compliance evaluation for each recipient so that we can assist them in meeting and understanding their civil rights obligations. If you'd like to take a look at the tool, it is available on our website. I don't have any slides, but I think we can definitely get that link out to you if you'd like to take a look at that. So just a few other sort of actions that I wanted to mention regarding our environmental justice program. One is the environmental justice strategy. So in May of this year, we were very excited to publish our updated departmental environmental justice strategy. And this is this covers 2021 through 2025. And the strategy, it reflects the department's renewed commitment to upholding the principles of EJ. While at the same time, it establishes new goals and objectives to support resilient communities with an emphasis on providing meaningful participation for all persons in federal environmental decision-making. So just a few points about the strategy. In particular, the strategy includes several objectives on advancing EJ in our federally assisted programs. So for example, DHS is committed to increasing awareness of EJ considerations and responsibilities under Title VI, including those obligations to persons with limited English proficiency. We will also take action to enhance climate literacy and its nexus with EJ among our federally assisted recipients. So in addition to the strategy, we've also taken action to integrate EJ and equity considerations into our climate change priorities. So this month, we actually released our first ever DHS strategic framework for addressing climate change. And this framework governs the department's efforts to combat the climate crisis. Achieving equity is a guiding principle throughout the strategic framework. And the framework identifies a number of goals, and one of which is to foster resilience, adaptation, and recovery efforts that reduce the risk and harm from climate change and address associated disparities such as those based on race and income level. So this equity, these equity considerations are really infused throughout the entire framework. Part of the framework, in the further discussion of our goals, we acknowledge that minority communities and low-income neighborhoods are often co-located in areas with poorer quality infrastructure that can be less able to withstand extreme weather conditions. So through the framework, we commit to addressing the disproportionately high and adverse human health and environmental impacts, as we're all familiar with that, on these communities, providing communities with timely, accessible, and tailorable information on risks, opportunities, and solutions, and to actively engage with our stakeholders on the challenges that climate change creates for them. And so finally, the framework emphasizes that the department will also leverage its grant-making and regulatory tools, such as Title VI, to promote and integrate equity and EJ into our resilience efforts. And one other piece I wanted to mention related to our sort of climate change priorities is the department's climate action plan. So this is sort of the step down from their strategic framework. The climate action plan for DHS really, outlines sort of the concrete priority actions that the department is going to take to increase climate adaptation and preparedness. The plan itself emphasizes that the benefits presented in the plan are intended to be shared equitably and fairly, and to promote resilience in underserved communities. So this is something that you're going to see a theme in a lot of our sort of guiding documents or strategic documents, is that there is an emphasis on infusing equity throughout. Of note, DHS is committing to expanding outreach and access for communities with EJ concerns to our financial assistance programs, to strengthen capacity in these communities for climate adaptation, and to ensure more equitable outcomes for survivors. One of the interesting things I think is sort of timely and on all of our minds is today is sort of these services and supply chain disruptions. So the plan recognizes that the climate-related services and supply chain disruptions, and that those disruptions may have a disproportionate adverse impact on communities with EJ concerns. So in the plan, DHS commits to engaging with these communities to better understand and prevent these impacts, and also seeks to incorporate adaptation requirements into DHS financial assistance programs to help address the impacts of these disruptions. Finally, I wanted to just talk very briefly about the department's efforts to implement the President's Justice 40 initiative, which I know many of you here are familiar with. So the Justice 40 initiative directs federal agencies to work with state and local communities to deliver at least 40% of the overall benefits from federal investments in climate and clean energy to disadvantaged communities. And so through this initiative, 2 DHS programs were actually identified among the pilot priority programs. So this includes the DHS Flood Mitigation Assistance Program, and that provides funding to states, local communities, tribes, and territories for projects that reduce or eliminate the risk of repetitive flood damage to buildings. And the second program is the Building Resilient Infrastructure and Communities Program, or BRIC. And that program supports states, local communities, tribes, and territories as they undertake hazard mitigation projects to reduce the risks they face from disasters and natural hazards. So as part of this Justice 40 initiative, DHS is working to implement federal guidance related to engaging communities and developing methods to calculate and report on reaching this 40% goal. So we're at DHS, we're committed to supporting disadvantaged communities and the equitable distribution of funds. So that's a lot to cover, but it just kind of gives you an overview of the various steps that we've taken at DHS as of late to advance environmental justice in our program and in the context of our Title VI compliance work. So we're really looking forward to continuing to engage with our stakeholders as we continue to expand our EJ and our recipient civil rights compliance program.
Thank you, Amy. And now we'll hear from Lynn Grasso from the Department of Housing and Urban Development.
Hi, everybody. I appreciate the invitation to speak with you today. I'm pulling up some slides and hopefully I'll have some success. How's it looking, Daria? All right.
I see a slide up and just, I guess, go into slideshow mode. If that works.
All right. At the Department of Housing and Urban Development, I serve as the Director of Fair Housing Enforcement in our Office of Fair Housing and Equal Opportunity. And as you can imagine, we serve a very critical role in environmental justice. And I wanted to speak a little bit about that and really highlight some of the areas that I think are particularly of interest and to you right now, and obviously to the department. In terms of environmental justice, we share a lot of the same civil rights authorities that you've already heard about today with my sister federal organizations. We have a couple extra little tools in our tool belt that we use, and I just wanted to touch on those. So obviously, as you've heard, like other agencies, HUD has Title VI enforcement responsibility over jurisdictions and other entities that receive federal financial assistance through the department. We also have a kind of niche civil rights authority, Section 109 of the Housing and Community Development Act of 1974. And this civil rights authority is also attached to federal funding, specifically community development block grant funding. And it covers also a pretty wide range of protected classes that I've listed here too. And again, this follows CDBG funding, and you'll understand why that is critical if you don't already know through my presentation. Also, we always want to remind our stakeholders that Section 504 of the Rehabilitation Act is also a very important civil rights authority in terms of environmental justice. I'll touch on a couple of the issues that come up there. This is also attached to federal financial assistance. You'll see these three authorities, I've put an asterisk there. Those are all attached to federal funding. However, we also at HUD, as many of you know, have significant enforcement responsibilities under the Fair Housing Act. And the Fair Housing Act prohibits discrimination apart from federal funding. The Fair Housing Act applies to recipients of federal funding in the area of housing and zoning and land use, but it also applies to private sector housing and actors. So, and I've also listed the protected classes under the Fair Housing Act that I'm sure you're probably all familiar with. So, how do we do environmental justice at HUD? In many of the same ways that you've already heard. We have a robust administrative complaint process investigating claims of discrimination under all the civil rights authorities that I've just laid out. We also address environmental justice through requirements that we apply to and review of community planning efforts. So in a number of our funding streams that go to jurisdictions, there are planning requirements, and FHEO, my office, is very involved in making sure that those planning requirements are met, that they address issues related to civil rights, and of course that includes environmental justice. We are also committed to ensuring that residents of new HUD-funded housing and rehabilitated housing, as well as existing HUD-assisted housing, aren't subjected to adverse environmental conditions. And like my sister federal agencies, we do compliance reviews. We do them. We have the authority to do a compliance review at our discretion, and we will consider issues that seem to raise concerns on risk or other concerns related to potential civil rights violations. But we also do front-end compliance reviews. We look at applications that come in. We have various intersections in the department where we review for civil rights compliance. And this is particularly one of the most challenging activities in my department because, as you can imagine, we have over 30,000 multifamily housing projects, thousands of CDBG recipients, and thousands of public housing authorities. We are stretched thin to do this kind of front-end civil rights monitoring and review, and are looking at ways to make our resources a little more robust and a little more effective at doing that challenging scope of civil rights work. So the area I wanted to focus on today particularly is how the department does its environmental justice work in the area of disaster recovery and mitigation. And why? Why am I focusing on this area? Well, in our changing climate, obviously, disaster recovery and mitigation, as you can expect, is a growing part of HUD's work. We, as I've mentioned, distribute funds to jurisdictions in the Community Development Block Grant and several associated streams of funding. Congress, however, has appropriated funds under the CDBG program, supplemental funds that are available to jurisdictions to do disaster recovery. And this is increasingly becoming a very large part of our portfolio. So since 1993, Congress has appropriated nearly $90 billion for CDBG disaster recovery programs. And as of April earlier this year, that meant 137 grants awarded to 64 states and local governments. Associated with those community development block grants that are for disaster recovery, we also distribute community development block grant mitigation funds to fund activities that lessen the impact of future disasters. And only since 2019, we've distributed more than $16 billion in CDBG mitigation funds. So these areas of funding are very quickly eclipsing the very traditional kind of streams of funding that we're used to talking about with HUD, and in terms of funding multifamily housing, in terms of public housing, in terms of just traditional development block grants. This is significantly a huge part of our book of business. Right now, we have active grants under CDBG DR and CDBG mitigation of over $67 billion. And as you can see, if any of you have reviewed HUD's portion of the Federal Climate Action Plan, which was published October 7th, our report focuses very heavily on this area. This chart right here gives you a little bit of an idea of the role HUD plays in federal disaster recovery and mitigation. We are the federal agency that distributes the second largest amount of funds related to recovery and mitigation, behind DHS, which of course covers FEMA provided funds. So Secretary Fudge was in New Orleans just in September, and I wanted to highlight some of her remarks because I think it really underscores why this matters so much to HUD. Secretary Fudge, when interviewed by local media, promised to address racial inequities in federal recovery programs. She says the first order the president gave was on equity. I'm here to ensure that equity is a part of the equation. If we don't do that, I think we have failed at the job and I have been sent here to do. So we are very fortunate to have at the helm at HUD someone who understands the importance of environmental justice and is committed to supporting our activities in this area. This next slide, I want to keep this up just for a bit, if I could, and kind of walk through this. This is the result of an examination that NPR did, and many of you are probably familiar with it. But the information captured in this slide tells so much of the story as to why environmental justice, particularly at HUD, is so important. These three charts show how disasters exacerbate wealth inequality across the demographic. We see how the Black population, the Latino population, and the white population here are impacted following a disaster. And as you can see, across levels of education, and even whether the household is a homeowner household or a renter household, we see how Black and Latino households lose considerable wealth after a disaster, while white households, as you can see, don't just stay the same, they actually gain wealth. This is information that has to drive our work, particularly in the area of housing related support. We can also see here how homeowners are more likely to gain wealth across the spectrum than rental households. And this is a very important area that we in FHEO look at when we look at disaster recovery plans, is whether the population of rental households is having their disaster-related need addressed. I wanted to touch very quickly on examples of civil rights intersections in HUD's disaster recovery work that address these things. The areas where we see there's risk, areas where we see problems, areas that we pay attention to because I think they have the potential to really result in the loss of wealth and the loss of stability that we just saw in the previous slide. We looked very closely at program methodologies that are presented by jurisdictions that tie assistance to home values. We see sometimes limitations in assistance to repair homes, to relocate, or to do buyouts to sell their homes, too often tied to home values and tied up in a methodology that has a harmful discriminatory effect on communities of color. So this is particularly impactful where the cost of rebuilding a home, the assistance that might be provided for a household to rebuild a home actually exceeds the award that will be given or even the cost of relocating to lesser impacted areas. This obviously leads to displacement from a community, not just relocation within a community, but displacement from a community. It results in families having to move far away to rebuild their homes with assistance that was tied to a lesser home value. And we know that home values very much follow patterns of segregation. Home values tend to be much lower in communities of color than predominantly white communities. We also look very closely at limited English proficiency, how jurisdictions ensure that action plans and recovery programs are accessible to to people who have limited English proficiency. You can readily find a significant conciliation agreement and voluntary compliance agreement that HUD entered into with the state of New Jersey following Hurricane Sandy that really got at some of these issues. We are also looking, I actually have this on because in that Sandy VCA, we also required the state to reprioritize some excess funding to address the recovery, repair, and rebuilding of multifamily housing. Again, an area that really furthers equity in disaster recovery. We look at the impact of floodplain elevation in new construction and rehabilitation, obviously the impact on accessibility for people with disabilities. And then we also look at how a jurisdiction's action plans ensure that opportunities for public participation were available. Written comment that was provided by stakeholders was considered. This is very important. I try and include this in a lot of my presentations. The importance of stakeholders to find and participate in those public hearings, to comment on action plans. We at HUD pay attention to that feedback that jurisdictions get, and strongly encourage stakeholders to be there in those opportunities. And then finally, I want to highlight that HUD announced in the White House Climate Roadmap that we are developing a universal notice to outline or to provide standing program requirements in the planning and distribution and use of DR funds. So this would actually replace supplemental announcements that we do related to particular disasters and appropriations that are made. This would be a universal notice, a standing notice that would address HUD requirements in the planning and distribution of DR funds for future disasters to come. We've not had anything like that before. We think this is a very significant move, and I wanted to bring that up for your awareness here to be looking out for that. Finally, how to file a complaint with HUD. You can call my office, the Office of Fair Housing and Equal Opportunity at HUD, at these phone numbers. Visit HUD.gov and learn more about filing a fair housing complaint. This is the URL, but if you just visit HUD.gov, you'll get there very easily. And I will finally like to say that in just the few moments before I came on camera, I've been working with my colleagues to open up a new email address, ej@hud.gov. We want to invite stakeholders to offer comment, feedback, input on our EJ work, on new developments. Keep the universal notice in mind. Keep your local action plans, if you're affected by one, in mind. Please reach out to us. We'd love to hear from you. I'd love to hear more from stakeholders about civil rights and environmental justice and how we can do a better job. Thank you. I appreciate it.
Thanks so much, Lynn. And last but not least, we will hear from Yvette Rivera from Department of Transportation.
Good afternoon, everyone. It's so good to be here today, and thank you for having us. And I am so proud of my fellow panelists and the hard work. I know that they don't sometimes respond to emails because they're so busy and, furthering equity and access. And so I am Yvette Rivera, the Associate Director of the Equity and Access Division of the Department of Transportation Civil Rights Office. I bring warm greetings from Irene Marion, our director, and from Secretary Pete Buttigieg. We have all said it in different ways, but we indeed have the wind on our backs. And for us at DOT, it's particularly important because we need to drive transportation equity and access. And in this context, when I say I mean all of us, the civil rights practitioners, both within the federal government, my fellow panelists, and all of you in the audience. When we were last here with you, you heard us talk about an important approach that we were taking at DOT, and that is to affirmatively and proactively enforce our civil rights statutes around the planning of the built transportation world. And if we don't do this, we are essentially complicit in discrimination when a Black-brown community is, for example, segregated or victimized by environmental pollution. In the built transportation world, where bridges may have already been built and concrete already been poured, getting a complaint after those actions take place, it's just too late. So to drive equitable and accessible planning transportation decisions, this past June, Secretary Buttigieg signed DOT's Title VI order. And this marks the beginning of a new era of affirmative Title VI enforcement throughout the Department of Transportation. Our order represents a long-term commitment to center equity and access in all the work carried out by DOT. So what does Secretary Buttigieg's order do? It adopts a proactive application of Title VI. We believe that Title VI and also 504, the Americans with Disability Act, must be treated as a key component in equity and access efforts, as well as an approach to advancing equity for all. As you know, you heard Daria and everyone talk about the executive order on equity that President Biden signed back in January. And so what does the DOT order require? Well, it emphasizes the importance of proactive compliance and meaningful engagement, community engagement, that is. And the order borrows from the critical principles of project management, which namely is scoping out the project and meaningful stakeholder engagement. So how will this be carried out? The order requires us to make an assessment before funding is obligated, showing that the conditions of probable Title VI compliance are present. Among other things, this assessment ensures that our federal funding recipients know the demographic data, know the communities that are going to be served or burdened by the proposed project or activity, understand how the community will be engaged and how community input will be considered in the decision making, know how to conduct disparate impacts analysis and how to design mitigation measures if disparate impact cannot be eliminated or the project is justified, and understand and account for the historical background of transportation design and services. By this, we mean the recipient should not perpetuate discriminatory decisions of the past. The terms of Title VI are wide sweeping. It does not mandate DOT to be concerned only with DOT funding, but any federal funding. Accordingly, the order also requires recipients to reveal the existence of lawsuits, complaint activity, and any investigation within 5 years, together with an explanation of the status of outcome or the outcome of each matter. These comprehensive Title VI assessments will allow DOT to identify and address potential Title VI issues early and avoid them through our technical assistance, which will require voluntary compliance. So further, the order requires meaningful community engagement. One consequential piece of this order is the requirement that recipients develop and submit a community participation plan for our review and approval. As mentioned, this is in keeping with classic project management principles. Recipients must meaningfully engage with stakeholders, communities early in the process to ensure that they are heard, their views are considered in the planning and decision making. We want our recipients to understand the science of community engagement, from properly initiating engagement, the types of engagement, and how engagement will be used in decision making. This means, among other things, that public engagement measures are linguistically accessible and free of barriers that prevent effective public participation in the decision-making process. By ensuring meaningful community engagement and by taking community feedback into account, DOT believes that many Title VI and equity issues will be addressed at the early stages in the process. And the order does not stop there. All throughout the transportation life cycle, we expect to be assessing compliance and accountability. To ensure equity and access works, what we want is to ensure follow through and continue compliance and accountability. The order really shapes the strategies and actions that recipients must take to be in compliance with Title VI. All of these actions are part of a comprehensive united effort to proactively uphold Title VI and ensure that the recipients of federal funding are not discriminating against people of the United States on the basis of race, color, national origin. So Title VI naturally supports equity and will give us the foundation to make it permanent, no matter what administration we have. Title VI has been here all along. DOT believes that if we fully activate this 57-year-old statute, we will make huge strides towards equity in our whole of government approach And in other words, we don't have a problem in lacking authority at DOT, but we have an authority that we have not been using to its fullest potential. I would also add that accomplishing the call to action, whole of government approach requires creative thinking on how we can leverage our funding requirements to further compliance obligations that recipients are bound to. And, I ask everyone to pause for a moment and contemplate the combined power we have to affect the promise of equity and access under these important statutes. The underserved communities throughout the nation need us to move this forward. And at DOT, we're speaking about DOT. If we want to realize the goals of Title VI, we must move away from reactive civil rights enforcement models, waiting for complaints to arrive, and move forward towards affirmative, proactive compliance. And when you think about what DOT is mandating through this order, it's quite apparent that we're asking transportation agencies to receive our funding. Let me repeat that. What we're asking transportation agencies to do is that map on project management principles in the design and planning of transportation projects, ensuring that all stakeholders are engaged and understood, and that the input of historically excluded communities are considered and weighed in the final decisions. In other words, applying project management principles that are inclusive, ensuring that Black, Brown communities are seen and treated as key stakeholders in the process. Our partnership is key to ensure transportation agencies begin to adopt an equity lens in their work, putting equity and inclusion front and center in their decision-making, and taking steps to ensure that we're serving all communities across the country. So thank you for listening, and we welcome your questions. I'll turn it back to Daria.
Thank you so much, Yvette, and thank you, everyone. Yvette, as you were talking about the Title VI order at transportation, it reminded me of a quote from a former Civil Rights Assistant Attorney General saying that Title VI is the sleeping giant of civil rights laws. Yeah. And indeed, the work that DOT, HUD, DHS, HHS, that we're all doing really, especially over these last 10 months, has really worked to awaken enforcement in that space. So I know we have a short period of time. I just got a list of some of the questions that came up in the chat. So let me just quickly, let's see here. Okay, we have a question related to Kalamazoo, Michigan. Our city is continuing redlining practices and gave millions to a paper mill known as Graphic Packaging to expand, which violates civil rights. And they filed a civil rights complaint, it sounds like with EPA against EGLE. And I guess the question is, are civil rights complaints the only tool we have to get environmental justice? And so I think, one, the direct answer is no. And maybe I should turn it over to Lily to answer. There are enforcement tools that we have at the federal level, but there are other resources. So I'll kick it to Lillian to respond.
Yeah, I would agree with everything you just said, Daria. I mean, obviously, the importance of the complaint mechanism is that it empowers people like Ms. Crawford to file complaints. And it gives, it doesn't have to be, a big advocacy group. It can be a private citizen filing these complaints. So that's the power of complaints. And of course, for all of my sister agencies and EPA, of course, it's not a discretionary activity. That is our meat and potatoes, right? We must address the civil rights complaints that we receive. So it's a very powerful tool. But aside from that, you know, like my sister agencies, we are trying to push our resources, and we're all strapped to be more proactive, more affirmative in the way that we approach environmental justice and especially Title VI enforcement, so that it's not all complaint reactive. It's compliance reviews, affirmative compliance reviews that we focus and that we target very carefully. There is so much need out there from an environmental justice perspective. I know that we can't address them all, even through affirmative compliance reviews. But what we can do is issue guidance, to our recipients. Make it very clear to recipients that we won't tolerate certain types of discrimination, and very importantly, the same affirmative approach that we're taking in the federal government needs to be taken by our recipients themselves. They need to start making very conscious efforts to take into consideration disparate impacts that their actions may be having, to really foresee how a permitting decision might impact a certain community. And if there is a disparate impact, make sure that you are looking at the fact that you need to mitigate, you need to address, you need to think about less discriminatory alternatives to those decisions that may be causing those impacts, and mitigate those impacts. And I think if we enter into this partnership with our recipients to do that as well, right, to implement Title VI on their own, instead of us having to tell them to go ahead and do it through complaints, through compliance reviews, through guidances, it makes a huge difference. And we have already seen a number of states starting to implement legislation on environmental justice. Not just environmental justice, but I mean, in our conversations with ECOS, with the Environmental Council of States, many states are thinking through how to incorporate a Title VI analysis in addition to thinking about just environmental, impacts and how they might be occurring, to actually implement an analysis, a Title VI analysis, so that it pivots folks from just acknowledging that there's an impact, that there's a disparate impact, to, okay, how do we address those impacts, and are there less discriminatory mitigations that we can, make to these actions to have less discriminatory impacts.
Thank you, Lillian. And I know that our time is short, but we did get started a little bit late, so I'll present one more question. This one is directed to HUD, to Lynn. It's actually a multi-part question. So I'll read it, and you let me know if I need to repeat anything. What can you speak to in the area of reversing the effects of redlining in neighborhoods that continue to suffer from the results of biased lending, substandard housing, and the concentration of Black, Indigenous, and people of color in areas that are already overburdened with environmental and climate adversity? Second part is, what have you identified as barriers to communities and neighborhoods actually receiving the funding that is designed to aid those communities? And lastly, how can the partnership help in addressing environmental justice concerns, and where is the accountability demonstrated? Oh, you're muted.
Sorry, yes, when time was of the essence. So I would love to hear from S. Strohs, I think it was, at ej@hud.gov. I would love to have a detailed conversation about what we're doing, but also hear from the stakeholder who clearly has a lot of experience in this area. So first of all, let me just touch on a couple activities, very high level. we reintroduced an affirmatively furthering fair housing rule, an interim rule earlier this year, and we are going through activities internally to work toward proposing a permanent rule. We also, or to proposing a permanent rule, I should say. We also, many of you may know, we have also stood up under the direction of Secretary Fudge, the Interagency Task Force on Property Appraisal and Valuation Equity. I think property appraisals, and that there is a significant intersection between property appraisals and environmental justice. So that's one thing I think will have a significant impact in this area. We have engagements from many of our sister agencies in this area and are really looking at what we believe to be long-standing patterns of discrimination and inequity that have taken hold in how we do property appraisals. So we're looking very closely at that. In terms of issues that we see, issues that we are working on, I really want to kind of touch on some of the things I said. You know, plans that in disaster recovery assistance are heavily tied to home value and how that negatively impacts communities of color. I think this is a very significant issue in how the department distributes its DR funds. I also think that how we ensure that jurisdictions are serving both homeowners and rental households in distributing assistance is very important, as I mentioned in my presentation. There's a lot packed into the question. I don't at all want to avoid it. Please reach out, ej@hud.gov. We'd love to hear from you.
Thank you so much. And I'd like to thank the conference organizers for allowing us to have space for this panel discussion. There is clearly so much that we could be talking about that our agencies are doing, and this has only been the first 10 months of this new administration. So I certainly expect there to be a lot more to come over the coming months, and particularly as there become greater investments in infrastructure going forward. We look forward to working together with our colleagues in the federal family, and also working with our critical stakeholders. As you heard, several agencies have had listening sessions and stakeholder outreach events, and will continue to do so. So I would encourage you to engage with our agencies, engage with the White House Environmental Justice Interagency Council, and identify opportunities where you might be able to provide some additional input and make us aware of any pressing concerns in your community. So with that, I thank you and wish you all a good afternoon.
Well, Daria, once again, you have done a fantastic job in leading this panel. There was a lot there and something for everyone. I hope everyone was listening and taking notes, and we'll follow up with some of the panel members with additional questions. I know I'm texting someone right now in Washington, so I'll be following up on a few things heard, but great information to all the ladies. We thank you. We hope that your connections and staying on each other's screens stays pretty consistent for the next couple of years as we try to get some things done. So thank you for taking the time to be with us for our conference this year and sharing some very, very important information. So this concludes our second day, but we're coming back for day 3 on tomorrow. And we're, of course, wanting you to be there and to be there on time and joining us. Tomorrow is day 3, and we will be starting at 9 a.m. with panel 6. So you don't want to miss that. Panel 6 is going to look at social justice and health disparities and environmental justice. And so you definitely want to be there for the start of that on tomorrow. Again, this is the 13th National Conference on Health Disparities and the 2020 National Environmental Justice Conference and Training Program. We hope that you are finding that we are addressing the issues of health disparities, environmental justice, and shaping the future of healthcare. We invite you to post your comments, post them in the chat room. We want to know what you're thinking. We want to make sure that we're hitting all the right spots for you and getting you the information that you need. Again, we will, as on yesterday, have access for you for recordings of today's conference. So you'll have that if you'd like to share that with others. Again, I'd like to thank you for being with us today and being a great audience. And until we see you tomorrow morning, I'm Carolyn Sawyer, and we hope you have a nice evening.